Good evening, everyone. I'm calling the county board meeting to order. Would the clerk please call the roll?
Rosales, Schrader, Schwartz, Shore, Weibel, Alex, Anderson, Bergson, Carter, Coert, Esri, Harper, Harrison, Harkey,
Here.
Jay, Maxwell, McGuire, Michaels, Mitchell, Quisenberry, Rector, Petrie.
Present, quorum is present for this evening's meeting. Mr. Anderson, would you please do the reading for the evening?
Thank you. As we come into the Thanksgiving season, I wanted to share a tradition of my household is after grace that we proclaim what we're thankful for. So I reflected upon what I've heard over the years, and I thought I might use some that are kind of universal and share those this evening on things that we can be thankful for. Let us be thankful for the alarm that goes off in the early morning hours because it means we're alive. For the spouse who says it's leftovers tonight because we're at home with the ones we love and not out at another meeting or event. For the teenager who's complaining about doing dishes because it means they're at home and not on the streets. For the mess to clean up after the party because it means we were surrounded by friends. For the lawn that needs raking and the gutters that need cleaning because it means we have a home. For our huge heating bill because it means we're warm. For the lady behind us at church who sings off key because it means we have freedom of worship and we can hear. For the weariness and aching muscles at the end of the day because it means we have been capable of being active. For our democratic system of government, where we can vote for our candidate of choice. For the media and their reporting, because they inform the public and keep elected officials accountable to their constituents. For the taxes we pay, because it means we have income. For all the complaining we hear about our government, because it means we have freedom of speech. And lastly, let us be thankful for the clothes that might fit a little too snug because it means we had enough to eat this Thanksgiving. Thank you.
Thank you very much. Pledge allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Will the clerk please read the notice of the meeting?
Notice is hereby given that a regular meeting of the County Board, Champaign County, Illinois, will convene on November 19th, 2015 at 6:30 p.m. in the Lyle Shields Meeting Room, Brookings Administrative Center, 1776 East Washington Street, Urbana, Illinois, in said county for the purposes of allowing and ordering payments of claims against the county, receiving and acting upon reports of committees and such other matters as may be brought before said meeting, which said meeting shall continue in session from day to day until the completion of said business.
Thank you very much. A motion to approve the agenda and the addenda for this evening. Ms. Coward, a second, please. Mr. Anderson. Any additions and corrections? Seeing none, all in favor say aye.
Aye.
Those opposed, nay. All right, thank you very much. We're going to take up again the business of nomination and election for the vice chair. So those are open on the floor. Mr. J.
I would nominate Stan Harper.
Thank you very much. Is there a second? All right, Mr. Rector, any other nominations? Mr. Alex.
I would nominate James Quisenberry.
Mr. Quisenberry's been nominated. Mr. Weibel, are you seconding? All right, there's a nomination for, and second for Mr. Quisenberry. Are there any others? All right, seeing none, I will close the nominations. And this will be a roll call vote for these two people. Will the clerk please call the roll? Yes. Do we have a chance to speak? Oh, yes. I assumed everybody's memory was so good and you all were so eloquent last month. Mr. Harper, please.
Yeah, I've done a lot of thinking about this, and I appreciate the nomination. I had a couple phone calls asking me maybe to back down so we didn't have any conflict. Thought about it, and I said no. I can add and subtract 12 and 10, and I can take getting beat, but I thought this might give her an opportunity to reflect a little bit on my 3 years here. I guess I was naive, stupid, or probably both. Coming into this board, I was always brought up, if you're going to serve on a board, no matter what, or where it was or what it was a public service. I didn't look at it as a job. If I could contribute and add to my constituents, I was glad to do it in any board I've served on. I guess, well, just to go back a few years, when I turned 18, and I'm not going to tell you how many years ago that was, our little district out there, and my parents were big-time Republicans, said we had a gentleman ran a filling station, was our county board rep, was a Democrat, Harold Tub McCoy. My father said, when you go to vote, you make sure you vote for Tub McCoy because he will take care of our district and our constituents. Moving on 40 years later, I find out that you have to do what the party tells you to do. You don't have the freedom to voice, you have the freedom to voice your opinion, but you're also threatened with the fact that we will get you if you don't vote the way we want. Well, it's a good thing I'm not that way because I've always been a person that expressed my opinion and stood behind my opinion, right or wrong. I guess there again, I'm naive, stupid, or both. Then one other thing was a month ago. I've never seen a body of government so disrespected in my life. The people that just completely disrespected the voices of these members of this 22 people here are elected to vote their opinion. I can't stand that, and if you support that kind of behavior, I am sorely mistaken, I guess. It just appalled me. As I was accosted in the parking lot that evening, I wasn't very polite to some people because they were right in my face. And another person said, oh, we got to behave, we might need his vote. Well, they'll never get another vote out of me on that project again. I've always been brought up, there's two sides to every story. I will listen to both sides to every story and form my opinion myself. But, if you want to beat me, that's fine. But I'm not backing down. Thank you.
Thank you, Mr. Harper, and my apologies to both of you, just assuming that everybody remembered from a month ago. Mr. Quisenberry.
Thank you, Madam Chairman. I do again offer myself as a person who can do this role. The role of the vice chair is to run the meeting when the chair can't be here. That's its responsibility. Having served on this board since 2010 and had the opportunity to run meetings for about 3 of those years at this point with the Policy, Personnel, and Appointments COW, I think most of you are very familiar with how I do that, the direction that I come from when I lead us, which is not to guide or steer, but to allow everyone to talk and to listen and to sometimes probably let it go on more than some people want to hear it, but we have a lot of voices on this board, and I have seen at times when I'm sitting in that chair, this board work as a consensus building group, and everybody sharing and not necessarily agreeing, but feeling like they got their points out. I enjoy doing that. I enjoy having that opportunity, and I feel like service is an important part of everyone's life, and so this is an opportunity that I'm making myself available for. I guess I always feel like you should never let an eloquent speech persuade you to do something that's the wrong idea, and you never should let ugly speech or the behaviors of others dissuade you from a good idea. That's their speech. They have the right to deliver it, as we heard earlier. Whether we like it or not, freedom of speech means supporting or protecting the right of someone to say something you absolutely abhor, or else it's not freedom of speech at all. So when I sit at the front of the room, I try not to quell speech, though I may disagree with it. And I can do that in the unusual circumstances that would lead to Patsy not being here. I can do that, and I can do that fairly. And I would like your vote.
Thank you very much. Mr. Jay?
If I might speak to my nomination, I was disheartened, quite frankly, when we decided to open this up and we'd have a Democrat candidate. I thought we had actually gained some ground to try and smooth this Republican versus Democrat kind of issue that in the past had gotten out of hand, and I thought we had made some headway there. Not saying that either one of these candidates aren't qualified, that's not the purpose of this, but what has worked is sharing responsibility. One of these candidates has the most important policy committee of the county board already under his belt. The other one doesn't have any major committees under his belt and would be more than able to handle this. And so would the other candidate, by the way. But my point is, we had been going forth with trying to stop this Republican versus Democrat issue, because quite frankly, if we were all honest with each other, we don't serve the Democratic Party or the Republican Party, we serve the people of Champaign County. And that's what we ought to keep in perspective. And I'm afraid this is one step going back to partism. Thank you.
Are there any other comments? All right, seeing none, would the clerk please call the roll?
Shore,
Quisenberry.
Weibel, Alex, Anderson, Bergson, Coert, Esri,
Harper.
Harper, Harrison, Hartkey,
Quisenberry.
Jay, Maxwell, McGuire,
Harper.
Michaels, Quisenberry,
Quisenberry.
Rector, Petrie.
The vote is 9-8, and Mr. Quisenberry will be our vice chair for the remainder of this term. Congratulations, Mr. Quisenberry, on your election. Okay, reading into the record the dates and time of our upcoming meetings. Facilities is going to meet on the 1st of September at 6:30 here in the Shields Room. What? What did I say? September? Oh, boy, you can tell The fire in the house is still affecting me. Okay, sorry. I'll start again. 1st of December, 6:30, Shields Room, Facilities Committee. 6:30, the 3rd of December, Environmental and Land Use Meeting here in the Shields Room. And on the 4th of December at the usual time of 10 a.m. with donuts and coffee and juice at the Highway Building for the Highway Committee. The, what? Didn't I say 9 a.m.? Oh, okay, folks, all right. On the 8th of December, we're going to have a committee of the whole, and it's at 6:30 p.m. here in the Shields Room, and County Board will be meeting on the 17th of September at 6:30 p.m. here in the Shields Room. And I apologize for my distractions. I'm still distracted due to the fire. Okay, I have no slips for public participation this evening. Am I missing some, or we have none? Okay, then I will close public participation. And next, I'll entertain a motion to approve the consent agenda. Mr. Esri and Ms. Bergson, a second. And this is a roll call, please, clerk.
Shore? Weibel? Alex? Anderson? Bergson? Court? Esri?
Yes.
Harper? Harrison?
Yes.
Harkey?
Yes.
Jay? Maxwell? McGuire? Michaels? Quisenberry?
Yes.
Rector? Petrie?
Yes. All right, that passes. It's unanimous. Are there any communications from board members this evening? None? Not even a happy Thanksgiving to each other? Okay. We're, what? Oh. Okay. Okay. I asked for that, didn't I? All right. All right, omnibus motion for approval of the minutes, please. For the 22nd of October and the 27th of October. Mr. Maxwell, well, welcome back from Australia. It's nice to see you again. Is Mr. Esri a second? Any corrections you want to put into the record on these minutes? All right, seeing none, all in favor say aye. Aye. Those opposed, nay. All right, a unanimous vote. We are having this evening several presentations. Bruce is already up out of the chair. You're ready, all right. Thank you very much, both of you, for coming this evening, and you have the microphone on. I can't tell if the, yes, you're getting the microphone. Excellent. All right, this is a catch-up report on how the reentry program is progressing, and to remind the rest of you, both Ms. Bergson and Mr. McGuire serve on the reentry committee. So go right ahead, Bruce.
All right. Thank you very much for your time, and thank you for your support for reentry services in Champaign County. It's an important initiative. I'm Bruce Barnard, consultant working on reentry. This is Celeste Blodgett, who's the reentry program coordinator. And just to give you a little bit of a reminder of where we started and what you charged us with doing through the RFP process was to establish a reentry council to have the various stakeholders in the community that are involved in the reentry process begin to work together and coordinate the activities in the county, to do some research on best practice programs across the country, understanding what works, and use the Reentry Council to evaluate those practices and what will work most effectively for Champaign County, to begin to develop reentry programming build collaborative relationships with other organizations in the community that are working on reentry, and provide screening and linkage and coordination to existing services, and facilitate data collection and outcome measurement. That, in a nutshell, is what you have charged us with doing. In 2014, we did initiate the Reentry Council. It's been meeting regularly ever since. And thank you to Astrid and Jim for being regular participants in that. And also the Sheriff's Office, Alan Jones, has participated in that, as well as a broad range of people. And we've brought more people on who are involved in the reentry process in order to make that committee as effective as we possibly can. We've been doing screening and case management since like the second month after we began to receive funding. And we did conduct an extensive search of best practices in other communities in terms of the approaches that they've used to reentry. What that process has allowed us to do is to begin to understand the needs of the population that we're serving and to begin to more effectively reach out to the reentry population. And you'll see that we have done some program development. We have applied for grants for transportation, which have been successful. We have a current grant, or the FUSE grant was a systems engagement grant. We also submitted a Second Chance Act grant twice. Not all of those are successful. The Second Chance Grant Act was not successful, and the FUSE grant was not successful, but completing these federal grants, it's extremely competitive, and it's a process of getting the feedback and continuing to develop your program. We've done a great deal, and Celeste has done an outstanding job of contacting employers. We have a database of employers who are willing to employ the reentry population. We have a database of housing providers who are willing to provide housing. And in just a few minutes, I think you'll see why that has been so important and effective. One of the things that I really focused on was I wanted to the extent possible to make contact with every person who was coming home to Champaign County from the Illinois Department of Corrections. And that may sound like a simple thing, but it took some work to get that done. But we have been able to do that, working very closely with parole. We make sure, I mean, it's not 100%, because there are people who change location or phone number or whatever, but the goal to reach 100% of people we have essentially done as well as we can do with that. So the Reentry Council is very familiar with this, but we talk about contacts, which are people who we've reached out, had contact with, and provided information to. So everyone that we talk to gets information about a variety of community services to help them with their reentry, which would include peer support services, vocational services, housing, benefit outreach, all of those services that are available in our community that that population may need to take advantage of. So that's our contacts. Since the beginning of the program, we've had contact with 375 people. We offer them the opportunity to participate in a screening. The screening is not required, but we encourage them to come in, talk to us about what their needs are, find out what the community has to offer, and begin, if they desire it, to participate in some case management services. We've conducted 247 screenings, so 66% of those people who we have contacted have participated in a screening. And you'll see about 72% of them are African American, 22% Caucasian, and the other racial groups are not statistically significant. I don't even remember if there were any others. There's some Hispanic, which was less than 1%. Total engaged, An engaged person is someone who's participated in the screening and has asked us to help them in some way. So that's 120 or 32% of the people that we've contacted. So when we talk about referrals, everyone that we come in contact with is going to receive a referral to a service to assist them with their reentry. Linkage is when we've actually used the case management process to make that firm connection. So 100% of those that we've engaged have received referrals. Through our process of identifying needs, it helps us in a couple of ways. One is it helps us to understand how we can reach out to service providers in the community that are working in that area and build those relationships. It also helps us to find out where the gaps are and where, as a reentry council, we need to focus. So if you look at this chart, what you're seeing here is of the 120 people who have engaged, so of the 120 people who have participated in the screening process and have what we call a service plan, what identified needs do they have? And basically what we're doing is asking people, do you have a housing need? Do you have an educational need? So just looking for housing as an example, 47 identified a need for housing, so 39% of the population. They show up here as a successful outcome if during the time that we were working with them, they obtained housing. So 47 people identified a need for housing, 18 has successfully obtained housing while we were working with them on case management services. Employment, 101 and 62, and then it's also broken down there by percentage. You'll see that some of the things that almost everyone has a need for, such as benefits, we have a very good infrastructure and are able to refer them to community elements, benefits case managers, and make sure that they get that linkage. So we have a relatively high rate of successful outcomes with those. Housing is a little bit more difficult. There's a lot of barriers to housing for the reentry population in this community, and that was something that we were discussing pretty extensively at the Reentry Council meeting yesterday. But this just gives you a breakdown of the population by need and the successful outcomes as reported through that process. So what we've done to try and address those needs is we have several housing grants pending. Unfortunately, some of those rely on the state budget, so I would not put them in the category of likely anytime soon. But those, we have been attempting to develop essentially supportive housing services for people in the reentry population. We have local property owners who are willing to work with us and work with our participants. Same thing with employment. Through the benefit process, we can ensure that people have access to health coverage and can and assist them with linkage to primary health care, behavioral health care, in other words, mental health and substance abuse treatment, and transportation to appointments. We can provide bus tokens and passes for people who need that transportation to get to work or for other obligations that they have around town. So if you look at our productivity measures, so those are outcome measures, productivity measures, approximately 55 hours of direct service a month, which excludes the initial contacts, the efforts that we're making to contact people for the first time. On average, we have about 28 people released from Illinois Department of Corrections into Champaign County each month. And as we said, we're reaching out and contacting each one of those. And we have about 13 appointments scheduled a month for case management services. We do have a no-show rate, which is pretty typical with behavioral health. That's something else that the Reentry Council was talking about, is what steps can we take to get a better response from someone who agrees to come into a screening to make sure that they follow up with that appointment. It's a continual process of looking at the services and the structures and improving our ability to serve the reentry population and the citizens of Champaign County. So when I came to you before, I said the bottom line here is recidivism. What we want to do is reduce recidivism. So at this point, we're like a year and a half in. 13 of the 120 people that have been engaged in the program have received a new judgment, and that's the definition of recidivism. So we have an 11% recidivism rate at this point. We have 6 additional participants who have pending charges, so that would bring us up to a 16% reoccurrence rate. If you look at IDOC's population, if you look at the Kalmanoff study, we're talking about recidivism rates of approaching 50%. One of the things that we really want to do and have worked really hard on, and through a combination of barriers, is to actually have a much better understanding of what that recidivism rate is by charge for the people in Champaign County. And we have data. We've gone back and forth with the folks who work on the data for the county to try and get it in a format that will do what we want it to do. And we have it now, but the person who was helping us with that data has not been available. But we are very close to being able to actually look at recidivism data for Champaign County by nature of charge, by the time period that we were involved, so that we can come back to, the next time I come back to you, I will have a much better picture of what the baseline recidivism rate is. But from the literature, from Kalmanoff, from everything that's out there, I can tell you, including the IDOC published recidivism rate, it's close to 50% is what we're comparing to.
Bruce, do you
Yes.
mind taking a question
not at
during
all.
your presentation?
Not at
I
all.
think Mr. Alex has a question.
You know exactly what it's going to be. Are the individuals who are going through the reentry program and not reoffending because the population that was not going to reoffend was the population that self-selected to go through the reentry program? I mean, there's a bit of confirmation bias possible there, right? In
It's
that you only
possible.
reach
It's
to
possible.
about a third of releasees said thanks but no thanks
Well,
to your help.
66% went through screening.
Okay, so and a third said we're not going to participate.
Right.
So are the 66% who are participating those who are less likely to reoffend and vice versa?
And I definitely understand.
I
the
mean, do you
question.
have any reason, even inkling as to how much that is a factor? Because this is, I mean, I'll say this, I'll speak a little more to this later, but, you know, there's a lot of money at stake here. You know, every percent that you can lower the recidivism rate saves this county a lot of money if you're the reason that it's getting lower.
Yeah, and I can tell you that the data looks really good right now. Can I tell you that this program is responsible for all of that? No. Can I tell you that for every one of those, I can't remember how many there were, 30, 40 some people who obtained housing in part responsible for that? When you look at what's going to predict a successful outcome, housing is huge. So to some extent, just having that infrastructure to link people with available services. But I in honestly don't know if we ran the data. Did we run it for everyone, whether they screened or not? So we're reporting 11% recidivism for the people who engaged. Did we run it for everyone, whether they engaged or not? That's a simple thing to do, and we'll do that. I may show myself to be a liar, but I don't think that we're self-selecting for positive outcomes, but I could be wrong. I'll reserve the right
And I
to be
guess
wrong.
if I could follow up, I guess the other part of that with regard to housing is what percentage of the people who you were able to find housing would not have been able to find housing were it not for your assistance? You know, do we think it's half? Do we think it's a quarter? I mean, clearly, I assume there's somebody who probably, because they came through your program, found housing where they otherwise wouldn't. But also, I assume there's somebody who came through your program who would have been able to find housing even without your help. So getting a sense of what the actual impact is on the program in terms of their ability to find housing, and maybe that's, maybe you can only determine that by, maybe all you will get is a subjective opinion on the part of the participant, whether or not they were only able to find housing because of your program. But, you know, these are the types of things that we'll have to ask in terms of evaluating the impact.
But your perception, Celeste, because you're a lot closer to this than I am.
You're right.
That
The
there
people
are-
that have obtained housing through our program absolutely obtained it because of the program, because of the landlords that we are working with, because the case manager was actually able to help them be placed in permanent supportive housing. Yes.
But, and I do appreciate the question, and actually, because it goes right to the next part that I want to talk to you about, which is was there another question?
There's several questions. First, Mr. Quisenberry, then Ms. Bergson, and then Mr. Harkey. Those are the hands I've seen so far. And Mr. McGuire. Okay. That's the lineup of the next 4 questions for you. Mr. Quisenberry.
Yeah, it's less of a question now, more of a confirmation. If you could provide us the recidivism over the whole population and over the population that does not go through the screening, that would be useful information for us to see.
And that's.
I'm not going to predict what it's going to show.
Right.
I'm hoping it shows that we're
Right.
making a difference with our investment here, but it would be easier to make that case knowing
Sure.
that information.
And the key to that is the county data, because that's where the charge data
Yeah,
is.
if
So
for some reason we haven't been tracking it in such a way that we could do that, I would encourage us to do that going
it's-
forward.
It's not a matter of tracking it, it's a matter of getting the data in a way that we can use it in a format that is manageable. But yes, absolutely, that's my goal.
Ms. Bergson.
This isn't a question, but something that came up at the reentry meeting, which is the Housing Authority of Champaign County, the people who have public housing, do not allow any felons in, ex-felons in. So what happens if someone comes out of jail and their family is in public housing, they can't. The family can't leave the public housing, and they can't go back. They can't go home. And this is a local rule. Other public housing things do it in the state and nationally. So it's something we really ought to see if we can do anything about, simply because housing is huge.
Thank you. Next is Mr. Harkey.
Yeah, your numbers for people who do engage with you look really, really good, and I don't want to throw any shade on that because you guys look like you're doing really good work. The idea of helping 62 people get jobs also seems like a really good thing to me, better than a lot of headhunters do. And my point would be that maybe using those numbers might help you convince those who aren't engaging to engage more, because you can sell it. We're helping 62% of people get jobs. We're helping all these people. That increases your numbers, gets you a bigger data set as well.
Absolutely, and I think, you know, the informal network of people talking to each other has been partly responsible for that, you know, but I appreciate that, absolutely. I think you're correct. Thank you.
Mr. McGuire?
I guess I understand the questions about the recidivism rate, but but I thought Kalmanoff's number is that 50% of the people recidivize. And that some of those people now that we're working with in this program, a great percentage of them, whether it's 11%, 16%, or 20%, are self-selecting now, the caseworkers and the programs that we're providing through this program, and deciding to go a different direction. The system itself, with 400 people coming out of the county jail there, IODOC, is something that they decide for themselves to accept those things and to change the direction. One of the things they say within the first 2 weeks, if there's some community support, is the best opportunity to change that direction. And changing someone's life who's been in jail for some period of time or in prison, and the idea of finding a job or someone giving them a job is a pretty significant thing for them to even get over. And having these programs and the opportunities that they're talking about and having them believe someone really wants to help them is a major thing. And I think the rest of their discussion will show that over the last year and a half. We've had a significant increase in the number of people asking for those, and even a 30% improvement in recidivism rate of 400 people, 250, 25,000 per. You're talking hundreds of thousands of dollars, besides the impact to the families and the community, especially when we got other programs that we're going to be discussing. But with what's been going on in the newspaper lately, and I'll ask Bruce for his autograph later from the news articles I've seen, but we obviously are having an impact, and a positive impact, for what is a chunk of money, but I think well worth it.
Thank you.
Okay, seeing no more questions at this point of your presentation, would you go on?
Reaction surveys, which actually kind of goes to the question that you're talking about, is may not seem important, but to me it is actually some of the most important data that we have, because I know from decades of experience in substance abuse and mental health that positive outcomes are predicted by continual engagement in services. So when I think about designing programs, I want to design programs that people want to participate in, that they feel are worthwhile for them, and that they're getting something out of. So I take 100% of participants who would refer a friend in need of similar help to be a very, very important measure, because that's going to reduce the number of people who decline the screening. That's going to increase the number of people who are going to engage in services. So 94% satisfaction, 81% experiencing improvement in their situation while they were engaged in services. And given some of the barriers that this population faces, I think those are really important measures. I'm always looking forward, and I'm always looking at what we need to do next. I want to increase the amount of your funding that's going towards providing direct services. I think a lot of infrastructure has been built. We have some momentum with the Reentry Council. We have now put together enough of these funding requests that we can do that more effectively, more efficiently. We have the data. So we're in a position now to allocate more funding towards direct service, continue to work on establishing contact with people who are incarcerated, especially in IDOC. The data says that the best outcomes happen if we're able to contact people before they return to our community. So far, we've pretty much been limited to contacting people as soon as we possibly can. We've established a really good relationship with parole, and we're able to get to people almost always within 72 hours. But actually, if DOC could give us the notification that someone is going to be released within 2 weeks and to Champaign County, and we would have the ability to make contact with them before their release. That, I believe, would increase our effectiveness dramatically. And we've just not been able to get that done. Coordinate reentry with the Justice and Mental Health Collaboration Program, which is the federal grant which was funded to look at the link between justice and mental health. That's a Department of Justice grant. And while reentry is on one side of what we call the sequential intercept model, thank you. On the other side is law enforcement strategies, diversion, those kinds of things. And the JMHCP, or Justice and Mental Health Collaboration Grant, focuses on those things. It will have a council very similar to the Reentry Council. One of the things that's exciting about that, we're one of 5 counties that were funded, and we will be receiving some of the best technical assistance that the Department of Justice has to offer to counties to try to understand what steps we can take to improve outcomes, both for people with mental illness, for our law enforcement folks who are interfacing on the streets, and for our county and for our citizens. So I'm really excited about that. And Celeste will also be involved with that as a project coordinator. And one of the things that, the last thing I want to point out that was very successful was the Reentry Resource Fair, which brought a lot of people and brought some employers together and service providers together. We got very positive outcomes, or feedback on that. So we would like to continue to do that twice a year to bring service providers and people who need those services together. And with that, I will wrap up.
Thank you very much. Further questions from county board members? Mr. Alex.
I guess I would preface these comments by saying, and I think I may have made Mr. McGuire a little nervous there. You know, my concern about being able to understand what these statistics show is not based on trying to make sure that this program fails. It's, if anything, trying to make sure that this program succeeds. You know, when we first put money for this in the budget a couple years ago, there was considerable discussion about what value we'd get out of it. I know that at the time, the hope was that we'd be able to leverage our investment into a larger federal grant, which of course didn't happen. Those are very competitive and hard to get. We understand, appreciate the extent to which you have been able to get, you know, funding from other sources to supplement what it is that the county board is putting into this. You know, this program costs about $100,000 a year of the county's money, and if we can reduce the average jail population by 5, it pays for itself, and if we can do better than that, it makes money, so to speak. So, I mean, I think what I like about this program is it's something that you can support on the basis of, you know, wanting to do the right thing and wanting to provide opportunity for the most vulnerable members of our community. And you can also support it based on sound fiscal principles, that if there's a way to, you know, reduce the number of people who we have to incarcerate, there's a significant advantage to that too. So I would like to see that this program is working. I would like this program to work. I think there's evidence in other communities that similar programs have been successful. But, you know, next year I will be asking
Absolutely. I would
the same question.
I would expect you to.
And asking to see, you know, what's your estimate in terms of the number of people that we're succeeding in keeping out of jail. So I guess I encourage you to continue. I express my appreciation for your work you're doing on the program. Ask that you continue to look at this as an evidence-based process and you know, be able to justify what it is that you're doing. And I'd like to express my thanks to the members of this board who have been very, I think, cooperative in terms of seeing that this program was funded and continues to be funded for long enough that we can really fairly determine whether or not it's showing results. I had a question. You know, there's been a discussion in the last couple of weeks here in this community among the law enforcement agencies about, shifting policing strategies away from sort of blanket policing of higher crime neighborhoods and toward identifying individuals who are responsible for the most violent crime or who can be, brought in and sort of targeted as people with whom we can work to try to reduce the level of violent crime in the community. One question I know I've asked you in the past is who the optimal population for you to work with is. I think that as this program went along, we would get a feel for, we're most likely to be able to prevent recidivism among, people who are coming out of prison or people who are first-time offenders, or people who are frequent flyers, or, do you have a feel for what sort of, whether there's a subset of the reentry population where the program is most effective? Do you have a sort of a model customer, so to speak? Or do we not know that yet?
It's a complex question, but I think I do have an answer for you. And I'm not sure it's formed by research. It may be just my opinion. But I think that the population that needs these reentry services are the most are the people who are returning to this community without a significant support system, without significant family supports, without significant faith-based supports or other supports that often in a community may provide some of that resilience that we're trying to offer. So in that case, because those supports have a tendency to deteriorate with time, that actually the folks I think who would benefit the most from this are people who are spending a fairly significant amount of time in a sentence and now are returning to the community and really trying to rebuild a life from scratch.
I think that's useful information to know, and it makes sense because, it was originally discussed, whether this program should even work with people who are coming out of prison or whether it should basically be benefiting only people who are coming out of the county jail. The theory being that the recidivism was, at least sort of low-level offenders who were frequent flyers. And it's, to the extent that we can understand better who it is that ends up back in the jail, I think we'll be doing well to do so. And what you say makes a lot of sense, that it's not necessarily, the offense or the where they serve their time, but what they have to come back to.
And your funding has allowed us to provide those services to that population coming out of the state prison system that really was not eligible for any of the mental health board funded services which required a substance use diagnosis or a mental health diagnosis that were really more intended, I'm looking at Alan if he wants to jump in here, but no, was more intended to try and reduce that jail population at the front end. And I think Justice and Mental Health Collaboration is definitely focused on trying to control that front end of the county jail.
Well, if I could add one more thing, I apologize for monopolizing the time. I like that answer because it also goes to what one of the criticisms of the program that I've heard the most from people in the stakeholders in the justice system, which is that it may be duplicative of services that are provided by probation and through drug court and so forth, that we provide other sort of post-release diversion options for people who are coming out of the county jail. But the one thing that everybody involved in the criminal justice system who I've talked to agrees on is that the parole system in Illinois is woefully under-equipped to follow up on people who are coming out of prison. They do well with the resources that they have, but it's just not it's not a strongly funded program. So I think to the extent that you are working with releasees from IDOC, those are probably people who don't really have anybody else keeping tabs on them.
That was exactly the conversation that we had at the Reentry Council and made a decision to prioritize that population for that very reason. So
Thank you.
I appreciate that.
Mr. McGuire.
Sorry, I was going to bring up one more thing. And one of the other things this program does, or has tried to do, is with that list of people that are listed, try to find all the opportunities of engagement, health and all those things, and bring them together and see really what goes on in the whole county to help different people, mental health issues or health issues like healthcare consumer helps people sign up for Medicaid, those types of things, which can be sometimes very difficult for them to do when they first come back. And you were talking about changing community policing. And what will happen with that, and that's going to take a little bit of time. I'm not sure how much community policing will change as far as patrolling the streets and things like that. It's just who they'll be focusing some of it on. Maybe Alan would like to discuss that a little bit, but it has given us a laundry list of and help the community focus those resources from the community on different people that they're serving.
Any other questions from county board members? Okay, I have 4. Oh, I'm sorry, Mr. Maxwell.
Thank you. I thought I heard you say that if you could be given a list of folks coming to Champaign County being released by Department of Corrections at least 2 weeks.
Before. Yeah.
Before. What are the impediments to getting that lease, and how can the DOC be encouraged to be more forthcoming with that information?
That's a great question. I'm in contact with the reentry administrator for the state, and she said it's literally not possible to get that list. I don't know why. I haven't gotten a good reason why.
Thank you.
Okay, I have 4 questions. The first question, as you're lining up the possibility of jobs and working with employers, are you also engaging the folks at workforce and the change of that act that's focusing primarily on youth now? I have not seen them at many of the reentry programs or at the apprentice program that was offered at Douglas Centers, so I'm getting a little concerned that that resource isn't being tapped into.
Are you talking about the Illinois WorkNet Center with regional planning? And
Yeah, we
yes,
owe now.
absolutely. I've been there. Matt, our reentry case manager, takes people there. The 3rd Wednesday of every month, they have a job fair that we take participants to that are looking for jobs. I've included every agency that's in that building in the reentry resource fair. So yes.
Good. Second question, I heard a presentation yesterday at the Mental Health Board meeting from First Followers. And is there any collaboration between these 2 programs for reentry?
Marlon Mitchell is on the reentry
I
council.
saw that.
And was on the council from the beginning. He's had some conflicts with his coursework, so we have not had good collaboration for the last few months. But I consider that to be an important collaboration, and I'm hopeful that we will be able to reestablish a little bit more current communication. We had asked for meetings to occur on a regular basis, and I'm not quite sure why that hasn't happened between staff as opposed to at the Reentry Council. But that's an area that I think both First Followers and community elements need to work on, to be honest with you.
Okay, my third question has to do with the manner in which evaluations are done. I'm very impressed with the percentages, and I'm not going to ask for details this evening, but I hope that you'll put it in your tickler file so the next time you come before us that you can explain to us in more depth how you are obtaining the evaluations, because I really want to hear about that. They can be done one way or another, which will skew the percentages.
So just so I understand, you mean the method, basically,
The
of
method,
determining
yes.
the outcomes?
Right.
Okay. Yeah,
Okay.
absolutely.
Okay, and then my last long-term question, beginning in 2016, that'll be the third year the county board has supported this program with $100,000. And I hope that you all feel you have enough stability in your program to start looking at means and ways of changing some of the ways that you work with the people so you can start testing. You wouldn't want to do a control group because then you couldn't help these people. So there are other ways of figuring out if approach A or approach B or approach C is
Right.
much more effective. And since there's stability or the beginning of strong stability, you've grown roots with the program, that
Sure.
you could start looking at some of those aspects because indeed you may or may not identify ways to improve those percentages, which is what I'm
Right.
hearing
Yeah.
people would like to see
Absolutely.
happening for you.
Yeah. And the beauty of it is because we have the whole universe of data with the county. I mean, we don't have to have a control group because we have a group of people who have chosen not to participate that we can compare to. But your question, and at the risk of getting way into the weeds here, but one of the things that I'm really interested in looking at is that initial contact and that linkage to screening, all the way down to some motivational interviewing questions, some things that are designed to build that bridge and encourage that participation.
Absolutely, and you may or may not be aware of the research that Julian Rappaport and his
Sure.
students did. Okay, you know about that.
Yep.
Okay, any other questions? Thank you so
Thank you
much
very
for
much for your
coming this
time
evening. We
and-
appreciate it.
And for your questions. I appreciate them. It shows that somebody cares.
Yes, well, I think we show that we care by supporting this program into the third year now.
Absolutely. Thank you.
Thank you. Well, good. Next, we're going to hear from this distinguished group of four talking about the condition of our buildings. And as they're getting ready to be seated, we know we have 22 buildings, but they have chosen to subset a few of them, so they'll be talking about them as 25 buildings. They'll describe that a bit more during their presentation. And a tip of the hat to the Facilities Committee that we have come to this point in the process that we are hearing about our buildings and what we need to be thinking about. And another tip of the hat to Stan James. He's not here, but he pushed very hard when he was facilities chair. So would you, each of you, introduce yourselves and then give us your presentation? And thank you for coming this evening.
Thank you. I'm Robin Whitehurst. I'm a principal with Bailey Edward. We were the prime, we're architects and engineers. We were the prime contractor for this.
I'm Paul Boland. I'm a mechanical engineer with Henneman Engineering.
Carla Smalley, Bailey Edward.
Zach Schmidt, I'm with Burns Clancy and Associates.
And Burns Clancy did all the civil work on the project, civil engineering work on the study. So each of you should have two booklets, look like this. The one that will follow along with the slides that I'll have up on the screen is this one with the courthouse on the cover. The other booklet that you've got is a abbreviated version of the report, the facility condition assessment report. It's abbreviated in that all the detail pages of all the various aspects of each building that we studied aren't included in all this, just the summary by building is included. That data is available, and Dana has it, as well as it's available in electronic form as well. We did include one building the full data sheet so you can get an idea. It's for this building, actually. So you can get an idea what level of detail and how much information we looked at on each building. So for now, if you can all focus on this booklet, if you follow along page by page, you'll be following with our presentation this evening. So this slide is really just to tell you about the different areas, the topics that we're going to talk about tonight. First of all, the purpose and methodology of the study, some key concepts that are going to be very important for you to understand so you can hear where we're going with the rest of the report here. Results of the study, your current approach to maintenance and funding of maintenance on your buildings, and vision for the future of maybe some changes that can be made. So first of all, in terms of purpose of the study and methodology, one of the primary purposes was to assess the current condition of each one of your buildings. We also wanted, in doing that, to inventory your short-term maintenance and long-term maintenance needs of each building. And along with that, we would identify then a backlog of maintenance that needs to be performed. So items that are maintenance items that are overdue, haven't been performed yet. And then we wanted to determine, and the purposes of studies like this are to determine a national benchmark for each building's condition. So it's not something this team of professionals made up. We're operating within a standard. Also, this information, you should be thinking this in the back of your head as we're going through these results. How can I use this data to really take a look at capital renewal planning and facilities master planning? Because that's what you should be taking a look at. This study is a model, and we're looking at your portfolio, your real estate portfolio in a whole here. And we want to determine, we have to determine costs, replacement costs for each building. We'll get into that in a little while. And also, we wanted to look at what should you be putting aside each year to maintain your facilities. So the methodology that we used is set up, been going on, actually the Navy started this several years ago. APPA is the Collegiate Physical Plant Directors, and they've been studying this and putting money towards it because, again, those are institutions that have multiple buildings, that have multiple functions, and they realize they need to get a handle on things like facility costs and maintenance costs as they maintain their building portfolio. So they set these standards up. The building values, the replacement values that we're going to be using all come out of some other recognized, nationally recognized reference standards. Whitestone and Means are two other documents that we used. But this team did a review of all the drawings for the existing buildings where there were existing drawings that were good. We also reviewed any maintenance documents or records that your staff had. Each building was surveyed for 23 different components. Now, what a component is the roof, the HVAC system, the interior finishes, et cetera. So that's how we divided each building and took a look at it. We had to break it into pieces that way. We walked through each one of these buildings with maintenance personnel, and we divided and conquered. The civil and the architects went with different folks than Paul and his people did because, the engineers went with the people that are maintaining your HVAC systems, your plumbing systems, electrical systems. And that's really good information because they know day in and day out where their aggravations are and where, time is taken out of their day or periodically maybe to deal with certain buildings or facilities. So that information was very important and certainly was incorporated through in our report. We also consulted industry standards for our cost breakdown and cost proposals. I should also mention that you've had studies done by other AE firms here in town on some of your facilities associated with jails. And we were given all that data and information and incorporated it into our study, including the numbers. And in general, we're in concurrence. This team is in concurrence with the other studies you've had done previously. So like I said, that data has been rolled in as it affects and as it deals and talks about building maintenance. What's not in here is things like programmatic changes to buildings. So perhaps there's an existing building that it was originally designed for a function that you no longer need. We don't have dollars or haven't studied what it would take to adaptively reuse that. This is really the study, and dollars are going to be focused on what it takes to maintain these buildings and keep them in sound condition. So the next thing we want to do is we want to talk about these key concepts that I mentioned. And it's really important that we get these down so that everything else that I talk about when we talk about results is going to be based on these key concepts. So the national benchmark that we wanted to get to and the measurement tool is the Facilities Condition Index. That's here at the top of the page. And it's a math problem. It's the deferred maintenance backlog over the current replacement value of the building. We'll come back to the facility condition index after we look at the next term down, which is current replacement value. So, and it's abbreviated throughout this report as CRV. The current replacement value is the cost to replace an existing facility in kind while complying with current codes. So obviously, most of you know your buildings are older than last year, so the codes have changed, and we wouldn't want to replace back to the codes at the time. And codes get more restrictive, the cost gets to be more. Deferred maintenance backlog, that's another key term here. That's the dollar amount of all required or overdue maintenance, repairs, and upgrades on the buildings. So, and the team, used the methodology that I was talking about to get to the number for the deferred maintenance backlog. To get to the current replacement value, again, we use national standards, and we looked at the buildings by square foot, by building type, okay? And then that's how we got to those numbers. So in general, you should be thinking of the numbers and the study. It's a model. These aren't actual cost estimates on reproducing the buildings. They're not actually exactly as they are, and they're not actually cost estimates on the repairs. So going back to the facilities condition index, what that equation really is, it's the percent of the replacement value of the building that you need to spend in maintenance on that building right now that's been deferred, okay? So 5%, if you only have 5% of the replacement value in deferred maintenance, that's good. You're in really good shape. That building's in good condition. It's been, it's been maintained well. You're really harnessing, you're leveraging your investment in that building quite well. Fair, when you get to the 5 to 10% of the replacement value of the building in deferred maintenance costs, you're in the fair range. Now, the 5% for an institution like the county with a number of buildings that are built at a number of different time periods, that's going to be really difficult to attain. The fair range is probably where you want to be, and obviously as close to the 5% as we can get you, that's where you want to be. Because something that you're going to hear us talk about over and over again is paying for maintenance and doing predictive and proactive maintenance is going to be less costly than reacting to failure. And we'll give you some examples of that even on your buildings here tonight. So poor is anything greater than a 10%. Any building that's greater than 10% replacement value in deferred maintenance, that's going to score as poor. Now, we did this little color code system, so it's easy for you. You don't have to remember these percentages. If it's a green, it's good to go. If it's yellow, caution. We need to start paying attention. If it's red, warning. We really should be paying attention to this building because we're getting into that 10% range. So, any questions at this point before I move on? All right, we'll keep moving here. So when we look at the deferred maintenance backlog, and we start to quantify those deferred maintenance items, we want to look at them in 3 different time periods, okay? So this is another important concept and how the study is based. So the priority issues, or one-year issues, are anything that's really an urgent need for your buildings in order for them to maintain operations, for them to be safe, for them to meet code. So we've classified those as priority issues. Some examples are where you've got leaking, failed mechanical equipment, so you can't use the space. We would have classified any items we found like that under the priority items. The 5-year issues are issues of overdue maintenance. So this is where most of the overdue maintenance ends up being. The majority of important upgrades, maybe replacements, pieces of equipment, so on. A replacement of aging building systems. So we're also taking a look at the lifespan of building systems. So we break it down again by component, and we say how long should roofs last? How many years? How many years should interior finishes last? Mechanical systems, et cetera. And when we go throughout this study tonight, the 5-year issues are, and really it's the 0 to 5 year, or the one year all the way through 5 year. That's where we're going to focus our most attention, because that's where this model does a really good job of kind of indicating where you are and scoring where you are with the facility condition index. So when we start going through and talking about the facility condition index later on here, that's what we're looking at, is in that 0 to 5 year combined, where are we? What's our percentage of the replacement value? Then the 10-year issues are going to be issues that are where we see, perhaps you've replaced a roof, 10 years ago, it's got 20-year lifespan, it's out 10 years. We would have said then, okay, then that's going to have to be replaced out, another 10 years from now, and that's where that would hit in the report. So it's going to be upgrades of plumbing fixtures, maybe a mechanical system, control systems, that kind of thing. Again, keep in mind, buildings, all these different components of a building have certain lifespans to them, and that's what this is trying to do, is trying to look at when those need to be replaced and or predictive and proactive ongoing maintenance to, again, leverage the most out of your investment. So here's the map, it was introduced that we broke the buildings up into 25 separate buildings. There are several facilities where there are different entities within the county that maybe share one building, but they're different users, and maybe they have a different use type in the building, and maybe had remodelings of that same building at different times, or it just made a lot of sense to break it apart. Elias will get into tonight, and you'll see why we broke that up into actually 3 buildings. The courthouse we broke up into 2 buildings, the addition and the original building. So that accounts for some of the additional structures that you see. So when you flip through and in your detailed, your abbreviated report that you have that you maybe want to look at later, each building gets a cover sheet like this. And the cover sheet gives a synopsis below the picture of the building of some of the highlights or lowlights, how you want to refer to it, of some of the items that we saw, the deferred maintenance items that we saw that you need to pay attention to. And then on the right-hand side, this vertical column is really the scorecard. So you start at the top, and this facility it's this building, it's Brookins, and it's a $19.6 million replacement value. So your annual cost to maintain this building is $588,000 a year. That's based on a benchmark established, again, by APPA and other folks, and I can tell you that if this were a hospitality building, those industries are in the 4 to 5% annual cost to maintain, just because they're looking at replacing finishes and so on more rapidly than you would perhaps in an institution building. So the 3% is a fairly conservative number as measured by the industry. So it's 2 floors. It'll indicate the building was built in 1970. You've got some renovations in various periods. We didn't list every renovation here in the scorecard. And the area of the building, 93,000 square feet. That's important because that helped us get into some of these numbers for the model. But we identified in the 0 to 5 year that the deferred maintenance backlog was $1.8 million in this building. So this building right now, you need to spend $1.8 million in order to get that, that FCI rating from a fair, which it is now, into the good category. So some of the items from an architectural standpoint are, there's a couple of roofs on a couple of the pods that need replaced. There's some insulation that needs to happen, brick repairs, et cetera. But I think Paul has more to talk about on mechanical systems.
Sure, on the mechanical systems in pods 200 and 300, those have been rejuvenated with new AON rooftop air handling units and a new air-cooled chiller. So those pods, the treatment and the approach was correct, but the remainder of the building still is fitted with the original equipment rooftop air handling units that are gas-fired DX condensing units. So bottom center of the page, that's an example of the rooftops we currently have, and those are original to the original construction of the building, and those have exceeded their original predicted life. So the good news is those can be replaced in situ, in place on a one-for-one basis, and those can be planned for. They don't all need to be done at once, but as those continue to fail, we need to develop a replacement program for those rooftop units.
Yeah, so and this is real typical that we did for every building. So again, in your abbreviated report, you'll have that summary page for each building, and then you'll have a page of some photos that maybe highlight or show some of the issues that we saw at each building. What we wanted to show and put up on the screen here is just for everyone to see. This is just 2 pages out of the 15 that are the detailed database for the Brookins Center. Again, we didn't include that for every single building in your abbreviated report, but we do have the rest of the pages for Brookins in the back of your abbreviated report, just so you can see the level of detail that we generated on each building, all the components that were looked at. So that was architectural items. This is mechanical systems.
This will really be In the future, this will be used as a management tool by Dana and his staff to manage and budget for each building's replacements of mechanical, electrical, and architectural improvements, and all the buildings as a whole to help establish capital expenditure budgets.
So the next building that we wanted to kind of highlight, and again, we took 3 example buildings. So we have Brookins, the courthouse, and we're going to talk about Ilias in a minute. We wanted to take 3 just to show you an example of the level of detail and kind of how to look at the report in detail when you have time. But just to give you kind of some highlights of some of your buildings. Obviously, this is a big, important building. We broke the courthouse into the slide that you see up right now, which is the original courthouse building, and then the addition. But we're going to kind of group them together tonight as we talk. Again, the current replacement value for just this building is $13.5 million. Now, yes?
I see Mr. Quisenberry's hand. Do you mind being interrupted
No,
at
that's
this
fine.
point?
Great.
Yeah, I thought it might be good for me to ask a question I already asked at the facilities for the benefit of the full board. And that is, I got your explanation, but I think it's important for them to hear this. But as we look at these buildings, particularly the courthouse and later some parts of the Ilias building, you described very well for us at the facilities committee why the courthouse looks cheap and why the Ilias building looks expensive. And if you could do that again for the benefit of the full board, I would appreciate that.
Yeah, again, so it starts off with, it's a model. So when we looked at this courthouse original building, we're looking at a replacement dollar amount based on national standards, dollars per square foot, for a courthouse building with this many square feet, 46,000, nearly 50,000 square feet. That model doesn't take into account that this building actually is a beautiful carved stone, terracotta. So to replace this building in kind, it's not going to be $13.586 million. When I say in kind, with the same sorts of architectural detailing, the beautiful tower, the bell tower, the clock, all those things. So again, it's a model that you need to look at. And so again, so Ilias, you're going to look at that dollar amount, and it actually is more than this. It's really driven by the fact that the original building itself, and we divided it up between the original building and the 1970s wing where Ilias Training Center is within. And we'll show you pictures of that just so you can have a graphic picture. But that older original, which was a nursing home building, is 105,000 square feet. It's a very large building. And you look at replacement value costs for nursing homes, they're a high dollar value building based on mechanical systems, lots of plumbing, those kinds of things. So it makes the current replacement value be very, very high for it, and in comparison maybe to what someone would think that the value of that building would be. So it's a very large facility, dollar per square foot, it's going to be higher. So I think this is a helpful illustration because then as a model, what it means for like the courthouse building, especially the original building, and I know that you've done some repointing recently, there's dollars that have to be invested in that building to keep that architectural detailing and everything going and maintained. So that's something to keep in mind as you go through. But again, as you step back and you take all these facilities as a whole and you combine and you look at them in the aggregate, we think it's a fairly good capturing of the dollars that need to be invested and need to be invested on an annual basis to maintain all your facilities, if you want to think of it that way as well. You also can think of it as in the aggregate. Is that the answer that I gave before? Okay. I was hoping so. So I'm going to let Paul jump in here on this, and then I'll clean up with anything else.
As you can see on the courthouse and the new courthouse was added in 2002. That houses most of our mechanical equipment, the boilers, the chillers. But that was 13 years ago, and those have an ASHRAE anticipated life of about 30 to 40 years. So we're already 1/3 into the life of those. I will say that we spent a lot of time with three of your maintenance leaders, Dana, Bob Weigel, and Kirk Kirkland, and they are doing a very phenomenal job with the resources they have to keep these buildings maintained. The courthouse, one thing that's good news on it, the components that were installed there are very durable. The boilers are rebuildable for probably over 40 years. So the maintenance on this is in good shape, but we are 1/3 into the useful life of the mechanical electrical equipment already.
Yeah, in the story on the courthouse, both the addition and the original building is really on interior finishes. We're getting to that lifespan issue. The maintenance is doing a good job of getting in and painting some of those public spaces, but the courtrooms were all done very nicely with a fabric wall covering. It's time to replace that wall covering. So, you know, you've got a lot of courtrooms, we've got a lot of yardage of it, the dollars add up. Same thing with carpet, we're getting in the same place. The lower left-hand picture is something that you may not realize about the building. There's a mansard roof that goes around the addition that makes it look like there's a slope roof going all over the whole building. It's actually a low slope roof below that, and that picture is of the steel substructure that supports that mansard roof. There's a lot of steel that needs painted up there. So things like that are included in our dollars for this building. So if you look, both buildings scored good. So they're within that 5% of the replacement value. But again, you're going to start hitting some big dollar numbers on those buildings as some of these systems come of age based on when the buildings were either renewed or constructed. The last one we wanted to take a look at, and we're going to look at all three ways of dividing out this campus here, the ILEAS campus. So the original building is the first one I want to focus on. So those are the structures that are on the west end, and it was the original nursing home structure, and actually there's a structure that was originally part of the Poor Farm as well. We separated that from the later edition that was done in the 1970s, which was remodeled for the ILEAS Training Center. And we'll have a separate page for that we'll get into in a minute. But the original building, since the building of the nursing home, is really only occupied or only used for training sessions by ILEAS. Otherwise, it's pretty much abandoned, and the building looks it. And the big story here is that and again, the deferred maintenance, or the replacement value is $23 million, driven by how large a building it is. It's 105,000 square feet. So the annual cost to maintain this building is $702,000. But you can see our deferred maintenance backlog is $10 million. Now that could easily be $20 million. At a certain point, this building needs a new roof. The roof is actually falling in places, and I'll show you some pictures. There's mold in the building. It's not habitable. The $10 million is maintenance items, but you would have to put significant dollars into upgrading or changing this facility's use because, being that it was a nursing home, it's not really adaptable for a lot of other uses. And it's in very, very poor condition. Paul will tell you that the mechanical systems are all gone.
Currently, we just heat the building to prevent wintertime freeze-up. And that's the only reason we have the small boiler house behind. The building also has several building elements that have asbestos-containing material in them. So really on the mechanical, electrical systems, if we were to find a function for this building in the future, it would be a complete gut and redo of all the mechanical, electrical. It's served its useful life.
Yeah, and just some pictures here that sort of support what we're saying. Upper left is asbestos tile. That right vertical picture, that's an exit stair. So, really poor conditions, not safe conditions in this building. The boiler house is the same story, along with this building. It's of a similar age. And Paul, there's one working boiler in there?
Two existing boilers. One is an old Kiwani machine that was original, looks to me to be about the early 1920s. And one boiler that exists just to maintain wintertime heat in the old nursing home.
So we're at a facility condition index on this building of 53.1%. Now for both these buildings, we're over 40%, combined, we're right there. Once you start getting a structure that is in the 40% and over range of its replacement value, that's where you have to start kicking in and thinking about programming, because these numbers don't include accessibility issues. They don't include the fact that it doesn't meet code for sprinkler and fire alarm systems. If you start to spend any significant dollars on this building, you're going to trigger all those things to be brought up to current code. And so that number is going to grow, and you're going to be at the replacement value. That's why the rule of thumb is when you start getting into that 40% range, you're probably talking about a replacement of that facility. But you also, again, I want to emphasize, you got to think about, what am I using this facility for? How does it help me meet my mission and vision and on all those things that I'm doing as an institution or organization? If you don't have a driving programmatic need, then this kind of study, and this is where it leads into, is to talk about a facilities master plan. Well, what do we need to support our programs? Let's look at our programs and the way they operate and the services that we have to deliver to the people of Champaign County, and really get focused in on our real estate portfolio to make sure that it supports that. That's really what the purpose of these facilities is. But make sure that it's not pulling you back and diverting dollars maybe that could go into other things. So really, both these buildings they're beyond their useful life, and there's significant dollars that would have to be invested in them. And right now, it doesn't seem like there's a programmatic need for those facilities. The training center, on the other hand, the 1970s portion of the building, is another story. Building has what we would call really good bones. It was built well, and it's adaptively reused by the training center, done a very nice interior remodeling. If you haven't been in there and seen it, you should. They did a very nice job. It's been reused. It's shown that building can be completely maybe repurposed. There's still 2 wings that haven't been remodeled. It's a large facility, so it's a $21 million replacement value. We're in the fair range, you can see on the facility condition index, primarily because of some components. Again, it's a building from 1970, so you have some original building systems that need replacement. And also, there's a couple of wings that, like we said, haven't been renewed yet and haven't had interior finishes redone in them. So we're estimating at $1 million for your deferred maintenance backlog on this building.
On the mechanical side on this building, when most of the rooms were patient rooms, so in all those rooms, the heating and cooling is provided by a fan coil system, which uses either chilled or hot water to heat or cool that room, depending upon season. Those are mostly at the end of their useful life. ILEAS has replaced most of those. The good news here is those fan coils for each room are about $1,100 a piece. Those can be put into a maintenance budget and replaced as each one fails. There's not a need to go in and do a wholesale replacement of all those at one time.
With regards to site work at this facility, ILEAS in particular, the site work is severely deteriorated. All the roads are in the area, sidewalks, pavement, everything, at this point would need to be removed and replaced. Whereas kind of all of the facilities for Champaign County in general, there is general maintenance that needs to be done. Whether it be sealing the pavement for the parking lots to further the life of it, seal the cracks. Otherwise, if you don't perform the preventative maintenance on that, then it becomes to remove and replace, similar to as how it is here at ILEAS. So in general, something does need to be done at all of the sites. It's mostly preventative maintenance at this point, kind of further down the road, except for ILEAS, where this site is in particular, everything is severely deteriorating and needs to mostly be removed and replaced at this point.
So this page is the summary of the aggregate of all the buildings. Again, we have the color coding on the far right column, so you can follow the 5-year FCI. It's by building, giving you the replacement value and the 5-year deferred maintenance backlog. So your overall current replacement value for your buildings is $186 million. So the rule of thumb, annual cost to maintain your deferred maintenance is let's call it $5.6 million a year. Your deferred maintenance backlog is $22 million that needs to be invested. Now, we already saw that a good chunk of that is in the buildings we just talked about. And so your overall score for your buildings is 11.8%. Facility condition index, you're in the poor. So there's some other buildings that are 24-hour facilities that need to be maintained 24-hour that need some significant upgrades so they can continue to perform that, because it's another thing that's, to emphasize here is a lot of your buildings do need to be 24/7 operational facilities just because of the critical mission they serve. And there's a couple that don't have generators that really need to get generators installed. So that's baked into this number as well, because if we classified it as a 24/7 operation, it should have a generator, a backup generator. So that was taken into account on these numbers and the scoring and the ratings here. So again, with that, look at the 5-year FCI column, and you've got a lot, there's several buildings that are getting up to the 40% or at the 40% or over. So that already starts to tell us that we need to really look at our facilities and look at our programming and understand what facilities we need to meet our mission. The next charts are really started to take a look at the data and analyze it to see maybe we can start to focus on a campaign here. If we invest dollars, where are those dollars going to have the most effect for us throughout the county? So of the components that we surveyed, there's really 4 that are the top 4. Not really a surprise to the design professionals. That's where a lot of the dollars are. But building envelope at 25%, interior finishes at 24%, roofs at 20%, and HVAC at 14%. I think if we were to run this at the 10-year, that HVAC number is going to go up significantly. We're really right at that place where in 5 years, a lot of this equipment's going to need to be replaced, but in between that 5 and 10 years, there's going to be even more. So then we started to look at, is there some buildings here that are really contributing? Obviously, the big one that's taking up nearly half is Ilias Original Building at $10 million. Then we have the Sheriff Correctional Center, Brookins Administrative Center, this building, the nursing home, and adult detention facility. So that really starts to tell us that maybe those are some facilities we need to pay attention to, and those maybe need to start, the strategies for those buildings maybe inform us as a whole on how we need to look at this portfolio and a facilities master plan going forward. But we also wanted to talk about where are we in regards to funding and where should we be? So right now, we're classifying and as Paul said, your maintenance staff's doing a great job, your facility staff's doing a great job with the resources they have, but this chart is showing you they don't have the numbers that they're supposed to have. The rule of thumb would be, again, $5.6 million based on your current replacement value of your buildings. It's $825,000. That's maintenance plus what's been given for capital renewal. That's what you have is $825,000 a year that you're spending on the buildings. So they're reacting. They're not getting a chance to do predictive, proactive maintenance. They're doing repairs instead of replacements, which is, you can keep repairing something long enough that you've paid for the replacement over and over again. So we're in this mode of, which is really a cycle, we like to call it, because it starts to become self-defeating, this cycle of being reactive about maintenance instead of proactive and predictive.
We saw a couple things that are indicative of this. At the courthouse new addition, we have 2 air-cooled chillers on the roof with the exposed condensing units, and we were there on a hot day. They had a yard sprinkler set up to keep those condenser coils cool, and that will lead to other failures in the future. It will lead to the building not being able to be cooled. The compressors are running with all the unloaders fully operational. So those type of things, it's not uncommon to see that happen, but as I said, we're spending a lot of maintenance labor and effort on things that maybe we don't need to, buildings that we don't need to have in operation anymore. Another example is at the courthouse. We do have a control service company doing service work on that building, and they're replacing the original equipment parts, the Honeywell controllers, with some parts that are not Honeywell because they said they couldn't source them. So we worked with Bob, and some of the sources I have from the supply house in Peoria, we're able to get them to buy the proper controllers that keeps the full functionality of the temperature control system. So those are the type things we see that it's somewhat of a situation like for the want of a nail. If we can put more money and time into freeing the talent that we have up to do preventative maintenance, we can get away from some of the cycle of reactive maintenance.
Yeah, and I think it's really important that this point 3 on here, where your priorities for expenditures are dictated by failures. That's exactly what's going on. It's not till something fails that it gets replaced. And so you're not really leveraging your assets very well then, because there are points in all these systems and equipment where you can intersect it with maintenance at the right time, proactive and predictive, and you actually extend the lifespan and get the full investment value out of each one of these systems. And that's really what we're talking about. And not stretch your staff running around just dealing with crises or issues where they have a complaint from building users. So what we would like to see, you know, as part of this vision for the future is this facility condition assessment and some of these goals start to help you to optimize and prioritizing your budget with supportive data. So the database that Dana will get has the equipment in it. It has the year that it was installed. So that helps them to start to take a look at and plan for, well, in 10 years, that equipment's going to need to be replaced. So I need to plan for its replacement. I need to plan for those dollars in the budget, way ahead of actually needing to expend those dollars. And this is going to save you money as a whole. It's going to make it more efficient and save you as a whole money. You've got something that's unique about the county is that you have 24/7 operation of mission-critical buildings. You don't want to, you know, go to a failure on the systems in those buildings. That's not going to allow you to deliver services to your. So we want to avoid that and surprises. And again, I've been talking about this. Achieve the maximum life cycle for your building systems through that consistent investment in maintenance. And finally, inform your renewal and your facilities plan, which we've been talking about. So we wanted to take a look at it in a few more graphs here and make it a little bit more evident to you, you know, what can we do with this data and what can we do to plan. So this chart is really a funding chart to take a look at. If we keep maintaining our facilities the same way or funding our maintenance on our buildings the same way, which is the green bar at the bottom, vertical bars at the bottom, you can see those are horizontal, or those are all at the same level, so we haven't elevated that at all. The blue is your deferred maintenance backlog. It varies because of the lifespan of the equipment and the building systems. And then the red line is your facility condition index. And you can see we go from your priority to 5-year at 11.8%, and then we get out to 2024, you're at 29%. You're at 30% of the replacement value. So you got to do something before you get to that point, obviously. When you look at the funding scenario 2, this is really saying if we started in 2016 funding to the level that we should to maintain our facility condition index, you can do it. If you fund it that so that's that $5.6 million, so that's the purple vertical bars. Now, the way that this dips down at the 5-year shows you get caught up, and then as other systems need to be replaced in that 5 to 10 year, it ramps back up again. But really in your mind, you should be reading this as that it's more of a level. We start at 6%, we end at 6%. If we maintain that funding level, we'll be in that fair range and really close to the good range. And that's what it would take to be down that far. That's a big investment. You know, as we're saying, it's $20 million that needs to get spent, and it's $5.6 million a year, not near what you're budgeting right now. So another thing we wanted to do in talking with Dana and Deb and looking at the dollars was to say, well, and this is kind of getting into a little bit of a facilities master plan. So we're jumping the gun on it, but we wanted to take a look at it anyway. We know that the ILEAS original building is really dragging us down. What if we were to demolish that building? So we've taken that out of this chart here, out of this summary. And the same thing with the boiler house, that goes along with that original building, those would both go away. Sheriff Correctional Center. We know there's a study out there that says you need to consolidate those operations and not use that facility any longer. What if you were to sell that facility and get it off the books? Get it off of the current replacement value, and so you don't have to maintain it. Your current replacement value for all your buildings drops down to $150 million, almost $151 million. Your annual cost to maintain, the deferred maintenance backlog, drops by $1 million a year. So that's, you know, and these buildings that, you know, ILEAS original building, there's no programmatic need driving that. Why to maintain it? Why have, you know, maintenance staff be shifted off of other critical, mission critical buildings? That gets you down into a 6.3% right away on your facility condition index. And your deferred maintenance backlog drops down to $10 million, basically. Now, you got to spend some money to get there, right? The ILEAS original building isn't going to come down for nothing. So this is a funding chart that we did to go along with that revised summary. And you can see there's 2 purple bars there, one in 2016 and one in 2017. We're saying, what if you put $1 million in each one of those years to abate the ILEAS original building and boiler house and take those buildings down, turn that into a greenfield site, and then sell the Sheriff's Correctional Center. Now, we realize that $2 million doesn't include all the programmatic and other upgrades that have to occur at adult detention for you to be able to sell that other building off. We understand that. You've got separate dollars and numbers available to you. But just taking a look at it from a facilities condition index and maintenance standpoint, look what happens. I mean, we drop down, we get down into a really good range, and we don't start getting up into that, you know, even at 2024, we're not at 30%, we're at 24%. But without adding any other funding, then sort of realigning your real estate portfolio to go along with your program, we start to get some benefit there. And that's why we've been saying you want to look at these expenditures and you want to look at it in the aggregate and based on program. What do I need to provide services? So that was a real quick look at it. There's other ways to look at it where you can plug in dollars per year as you increase it, but really to fully get a handle on it, you need to be at that $5.6 million level. And finally, we wanted to, this is our last slide, we wanted to end with this vision for the future. You know, to talk about facilities are important. They're important for the county staff and board to meet their mission. It's also important, we've got your vision statement on there and actually your strategic plan. Facilities were number 2 on that as a goal to address these facilities. This study was part of that, so you're executing on your plan already. And we're just encouraging you to continue that because of the importance that these facilities have for you to meet your mission and vision. So that's our presentation.
Thank you very much. Now for questions from county board members. There are none. Mr. J.
I don't have a question, but this is a very good presentation. I really appreciate the effort you went forward to get it to us, and I actually was able to keep up with you and understand it.
Thank you.
All right, Mr. J. 5 stars from Mr. J. Any other questions? Yes,
So
Mr.
we
Red.
talked at Facilities Committee, so obviously with these financial needs, does this go to Finance Committee now? Or as we look towards the future and trying to address some of these problems?
Mr. Alex, do you want to respond? Do you have
No.
a plan?
All we need is an extra $5 million a year. I certainly would answer your question by saying yes. I think it goes to all members of the board at this point to ask ourselves how we can arrest the continuing decline of our facilities. I mean, this is something we've talked about for the last several years. 2 years ago, we were putting 0 basically into facilities, and for the last couple of years, we've been putting in a little over $500,000, which is clearly somewhat shy of $5 million. I would like to say we're moving in the right direction, but I mean, it's pretty clear this is a structural budgetary issue. And this board is going to have to look at either substantial changes in the way, in order to accommodate this level of funding of our facilities, this board would have to look at either substantial changes in the way we spend money or other sources of revenue or both.
Does that answer your question? For now. All right. Yes, Mr. Harper, please.
For Chris there, would you, to me, when I look at it and hear it, I think it's a no-brainer to tear down those buildings that are just, I mean, would you lean that way on the facilities, or what do you think?
Well, I'm not on the facilities committee, but I mean, I will admit I don't entirely understand the situation with the Ilias building. I mean, that's essentially a building that we probably would have torn down already if Ilias weren't continuing to find use for it. So I'd say to some extent, yes. I mean, that building probably has no long-term future. But at the time, or at the current time, Ilias is making use of it. So I guess it's a decision that should involve them in terms of whether the money that we're receiving from them and the use that they're getting out of that building is covering our costs to keep that building going a little while longer. But yeah, I would agree that that's probably that building is not going to be in any long-term plan. The situation, obviously, with the downtown jail and sheriff's office is a little more complicated, right? In order to close that building or sell that building, we'd have to build a sheriff's office, and at least build enough facilities at the satellite jail to make up for the single-cell housing capabilities that the downtown jail has and so forth. So, you know, we've already looked at a plan that we can't afford to do that, which would be required in order to not have to do what we can't afford to do in terms of maintaining it. So, as I said, clearly we've got a structural issue here that we're going to need to look at, both in the terms of a facilities master plan and in terms of a finance master plan.
Thank you for the explanation, Mr. Quisenberry.
Yeah, I mean, the good news is we don't have to be looking for the money for that older portion of the ILEAS building to keep it up to these standards. The bad news is, and the reason why I asked that question is, there's money it's going to take to keep up the original courthouse that's not defined in this standard because of the quality and the age of that building. To preserve it as a structure that does its function, it would be that cheap. To preserve it as the historic building that it is and the construction that it's made out of is going to take more than what's in there. So that's why I asked them to illustrate it in that term. There's a balancing act here. We don't need that 100,000 square foot older nursing home building, but we do need the courthouse to continue the way it is. And we've seen that in the last couple of years with the tuck pointing costs that we've had on that building. I mean, those costs alone probably exceed what this would predict.
Mr. Maxwell.
I think there's been a lot of good work done on this study. I think Dana and his staff deserve credit for the amount of work they've put in to assist with it. I think it's a great working document. It's valuable information for the people of this county to have. Maybe not a good news for them to have, but again, it's quite worthwhile that we do have this information and that we can work with these numbers in the future. The one thing that's not in there, and the next shoe to drop will be, I think we'll have a report on ADA in January or February. Whatever that report is, we have to do those things. We will not be able to defer them very long, maybe 30 months up to the most. Pardon?
We will have to have everything completed in 30 months from January.
So bear this in mind. You've read some startling numbers here. The numbers that will be coming in January and February are numbers that have to be, the money has to be found for. Thank you.
I saw Mr. Alex hand.
I was going to raise exactly the point that Mr. Maxwell just did about the ADA compliance costs not being included in these numbers. One thing I know that we'll talk about when the ADA compliance report or the ADA settlement is discussed is specifically the downtown jail and correctional center, which you know, if we have the option, if there is an alternative to keeping that building open, that would mean that we would not have to spend money to bring it up to ADA compliance standards. It's not clear to me that there is a means by which we can avoid that at this point, but we are sort of, when we went into the ADA settlement, my understanding is that, you know, we probably got some mileage out of saying, well, we're looking at plans to replace that building. So at some point we will have to make the decision whether we are in fact going to replace that building, and if we decide that we're not, then we'll have to deal with the ADA issues associated with that building, which probably aren't included in the numbers that we've looked at so far for ADA.
And they will not be included because Bailey Edward is not looking at those buildings for ADA because the Department of Justice did give us a pass on those buildings with our plan to do replacement and then renovation of the existing satellite jail. If that's not going to be done, then we're going to have to revisit that.
Mr. McGuire.
Okay, thank you. Maybe I missed part of this. So with this list, the secondary list that we had where we took out part of the buildings, is there a plan next to come up with some idea of what kind of budget? Because At what point will we go from a reactionary budget for our facilities to one that actually does maintenance on the facilities? Because we're actually, we need to make it a priority, have an understanding of what the number is, and look at this list and decide, kind of where Dana's going to go. What buildings are the priorities? Because I think the ADA is, the priority, but really if some of these systems fail and we need to come up with $700,000 when we could have done maintenance on something that would have cost us a quarter of that, we have an issue. But if we never decide on a plan to deal with the maintenance of these buildings, like now that we have this information, we'll never get to it. We have to make it a priority for the county.
Then maybe, based on your suggestion there, that we should consider a study session on this in February. By that time, we'll have both reports, and we can have a discussion on how we're going to move forward. Mr. Quisenberry.
My understanding of the outcome of the Facilities Committee discussion of this was our next step as the Facilities Committee is to let Dana and his staff absorb this and give us kind of their take on these things and the priorities they would assign to them, because they know them inside and out. So that's a step, and that can happen before February, I'm sure, but that's, from a Facilities Committee, I think that's our next step, is to get the staff reaction to this, well, much thicker binder of data that we don't have in front of us right now.
That's a good point, and I certainly will check with Dana and Deb to see what timeline will work for them. Do you have a comment, Mr. Alex?
I do. I guess I just in the interests of seeing the big picture here, I mean, it's no secret that the county board for many years has been balancing its budget by shortchanging our facilities investment. I mean, there are only so many things that you can cut, and we've obviously been faced with increases in some costs that we can't control, things like health insurance, things like energy costs, state mandates, so forth. We're limited in terms of our how much our property tax we can collect based on tax caps. The rate at which our revenues go up has not been has been less than the rate at which our expenses have gone up, and that's been a problem for 20 years. And I think what we're seeing here is someone has finally put a number to the extent to which we have been underfunding our facilities. And yes, it's something we're going to need to have a serious conversation as a board about whether we find additional sources of revenue, whether we deliver fewer services in order to be able to maintain the buildings that we have in a way that keeps them standing. So, study session or not, it's pretty clear that this is going to be a significant focus of this board's attention going forward.
Thank you. Yes, Mr. Maxwell.
I believe Chris has it right. During the coming year, I believe the Facilities Committee will work on these kind of questions and the priorities, and we may come up with some specific recommendations considering the status of a couple of those buildings. It's very obvious that at least one of them should not even be on the inventory at this point in time. So we'll be looking at the alternatives we might have. I think ultimately we'll need some additional revenue. At least we need to raise that question with the public, with our constituents, to see whether or not they would be willing to put up the additional revenue that's required to keep these buildings up. Thank you.
Mr. McGuire.
So in your discussion, there was 2 roofs in this facility that were leaking?
There's more than that.
There's more than that?
Yeah. I don't have a number off the top of my head, but Carla, do you?
Well, I remember there are at least 2 pods that need roof replacements. I don't know necessarily that they are actively leaking now.
In this building, but in terms of countywide, all the roofs,
Oh.
there are multiple buildings that require roof replacements.
Yeah.
So as a follow-up?
Are you,
'Cause
Go
there's a point-
ahead, and
there's a
then
point to the
I
question.
think Dana has some things to add. Go ahead, Mr. McGuire.
And obviously, the cost of the replacement of roofs are tens of thousands of dollars. But the damage that the water's doing to the, since it's penetrated the envelope of the building, is significantly higher, right? I mean, it gets it to the 40% that you're talking about for the replacement of the building.
Yeah,
And that cost.
yeah, you're talking about it's exactly the point that we were trying to make, that a roof is a good illustration of that. Your roof is past its useful life, or you're reacting to failures, localized leaks or whatever. By the time that happens, it's already damaged some other surfaces, ceilings, walls, other finishes. I like to call that collateral damage, because now I've got the replacement cost of the roof, the repair of the roof, plus maybe replacement and repair of the other interior finishes. We've tried to incorporate and grab that in these numbers, but there's multiple facilities throughout the county that we're seeing that happen, some a lot worse than others.
And just a small example, one of the items that's listed on here is a salt dome. It's only $53,000, but it's at 44.5%. Didn't we just put a new roof on that, didn't we? So the structure is actually damaged, probably, is why you're suggesting?
I think it's more the concrete and the steel and the pavement, again, the pavement around it, because they pour the salt out on the concrete and the asphalt pavement, and they kind of break it up, and it's eaten the concrete and the asphalt around it.
Yes, with the site, this site in particular, with, since it being a salt dome, salt is, when you add that much salt to a concrete surface, it eats away at it, deteriorates quickly. So that's what we found, is that due to the high volume of salt on site, that the concrete and the asphalt is chipping and deteriorating, cracking more quickly than it would if it was, just say at the highway garage or something.
And the roof on that is actually in good condition. Now, there is the entryway that you get into the salt dome area. I don't know if that was re-roofed, but there's some soffit damage around that, and the side panels, those are deteriorating. The wood around those are deteriorating. The steel that was used for the corner guards it's completely gone. It's rusted completely.
I think the theme is it's a very corrosive environment for building materials, and it's getting past its useful life, and probably staff put a roof on it because they needed to keep the water out, but they didn't have the dollars to get in and totally demolish and take that building down. Because what we're saying is we're getting to the replacement, but it's time, especially at the numbers that we're talking about for what the building costs.
Mr. J., did you have your hand up, or were you stretching?
Madam Chair, I was stretching, but I did have my hand up too. That was discussed in Highway. It's not a concern to the Highway Department at this point. The roof was a serious problem, and it's fixed. You can't handle salt with concrete and not have some issues. So we talked about that in Highway, and the highway engineer, it's not an issue. We've got some other issues that's far more serious than that one.
Okay. Other thoughts, questions while we have our panel of experts before us? Dana, you had some comments that you wanted to share?
I was going to attempt to answer Jim's question about roofs. We've got 3 buildings in particular that need assistance in the very near future. Satellite, downtown sheriff's office and jail, and here at Brookins. If you replaced all 4 roofs here, it's over $700,000. The downtown jail is about $750,000, and the satellite is right there with it. Those 2 buildings in particular, the satellite and the downtown jail, will need roofs very soon. We're constantly battling leaks, which, as the team expressed, constantly does damage to the interiors. We're chasing them down as quickly as we can, but it's added expense. It's wear and tear on the building. Satellite roof is 18, approaching 19 years old. Roofs need to be replaced every 20 years. It's an EPDM, it's a rubber roof, ballasted to boot. That means the rubber's held down by rocks that are on top. Once you have to, all our equipment, by the way, is on top of the roof, and every time you put a weight up there, you have the potential of damaging the roof with a rock, even though the river rock, they break, they're sharp. Those edges dig into the rubber and will cause you leaks, and it's very difficult to find those leaks in a ballasted roof. You've got to clear the rock out, which is not very good either. So we do have lots of issues. With our current budget, $832,000, you can do the math real quick. Replacing 3 roofs that are over $700,000. Yeah, close.
Well, and just to pile on that, there's along those other buildings, the jail buildings, they have significant water infiltration through the building envelope as well. So when you look at those detail pages for those buildings, realize that that's driving a lot of that cost. The deferred maintenance on those buildings is really trying to get a handle on the building envelope and water infiltration.
Thank you, Dana, and thank you for adding to the growing amount of money. All right. Jack Anderson, do you have a question, or are you contemplating the question?
I didn't want to talk. I'll be brief. Just looking at the list of all our buildings, you know, this is a matter that obviously has been kicked down the road a long time. I've heard mentioned this evening about the potential of generating revenue and how we might do that. And obviously, we're talking taxes. When I look at all these buildings and I look at their functions, my first question is, how many of them are actually mandated that we provide the functions that we are within those buildings? And that's what should be guiding us. So obviously, we need, you know, the sheriff is required to do what he does. The coroner has a function. You know, we have to have the Brookins building and all its functions with the elections and so forth, and the administrative overhead. I go down this list, but then there's a few where I question why are we in that business, or do we have to be involved in that function? Why are we paying for the maintenance of the buildings? And those are discussions that will be had in the future, I suspect. Because when I look at what we're paying for these, not just the building, but maybe we're subsidizing the functions going on within those buildings, maybe that's where we find some of the money we need to provide the maintenance that we need to be doing on all our buildings. And that's my comments. Thank you.
Thank you. Do I see more comments or questions while we have our experts here? Mr. Schrader, hello, how are you?
Thank you, Madam Chair. I'm fine this evening. Just to kind of echo some of the comments of my county board colleagues, the reports are very well done. I really appreciate how they're easy to read for someone like me and digest a little bit. Especially, I had more questions, but then I delved into the backup information and answered a lot of my questions. I guess it's hard to find some good things to say about these reports, but I think, unless I missed it, and that's why I want to ask our professionals here, at least we're not looking at, well, let me state first. When we get rid of, if we decide to get rid of the Ilease building, which is the old nursing home, the boiler room that goes along with it, and probably the downtown jail, at least we're not looking at any major electrical or mechanical updates. A lot of this is what I'm seeing is just what we've been hearing: delayed maintenance, roofs, structural part from the standpoint of masonry and brick and mortar and those such things. So I guess that's one thing we look at, because I think we could probably all agree if we start getting into a lot of that electrical and HVAC stuff, then we're probably talking a lot more money. So I guess that's one good thing I can glean out of this. Thank you.
Thank you. I don't see any more questions or comments, so we will thank you for coming this evening and sharing with us this report. And as people have already mentioned to you, It's visually a very easy report to digest, and for that, we appreciate it. Have a nice evening and a good Thanksgiving. I think we should take about an 8-minute break. I saw a vote for that, and we will be back shortly before 10 to 9. Okay, I think we have a quorum back in the room. I'll call the meeting back to order. Will the clerk please call the roll? Will the clerk please call the roll?
Sure. Weibel. Alex. Anderson. Bergson. Coert. Esri. Harper. Harrison. Hartke. Jay. Maxwell.
Here.
McGuire. Michaels.
Here.
Quisenberry. Rector. Petrie.
Present. A quorum is present. Mr. Gema, thank you for your patience this evening, and would you go ahead with the report on the nursing home, please?
All right, good evening, everyone, and happy Thanksgiving. Okay, so we'll just get. All right, let's talk about the census. So at the end of the month of September, our average daily census was 176. And obviously you can see that we have had I would call it a steep decline in census since June. Our current census as of today is 172. This is our average daily census on an annual basis going back to 2008 and then year-to-date 2015 through the month of September. So I know I always show you this chart, but the main point I want to bring out is that we have seen fluctuations in our census over the years. And we've been able to weather those and adapt to those changes. And again, 2014 was a record high census of 202, and obviously it was preceded by a fairly substantial low census in the year before at 188.8. So obviously so far this year we're at 190.7. And obviously that average number probably when I do it through October will decrease again. But I do believe that we are going through a cyclical cycle right now. And if you take a look at this chart, and this shows our monthly admissions and separations from January to October this year. And so you can see our admissions have been fairly steady, at least for the between February and September. Now, our admissions actually increased substantially in October to 21, not quite reaching our high, I think, in January of 28, but obviously a very solid month in October. But obviously, what we saw in February, March, April, and May is that our census went up because our separations were lower. And so over the past 4 months and in November, I think we're down a little bit. We've seen a high number of separations. And again, you know, it's a combination of deaths, but also we've had a substantial number of discharges home. So again, I take that with a glass half full, that we're doing a good job of taking care of our Medicares and sending them home. We've had a few residents that we've actually have transferred over to assisted living. So those are actually positive events that are occurring at the nursing home. But at the end of the day, it would be nice to keeping more of these residents in the building. But the fact of the matter is we are doing a good job of sending home residents. So what does that mean? Oops. again, because we're an enterprise, we can zig and zag with what's going on with the census. And again, the other point I want to reiterate with this is that since 2008, we've been dealing with these cycles of our census going up and down. And during those years where the census hasn't been great, we have never needed, we've always lived within the tax levy. So the moral to the story is, and I can't predict the future, even though I say that I believe it's a cyclical event, you know, we can adapt because we have adapted in the past to meet the requirements that you have put on MPA, which is to live within the tax levy. Payer mix, so far this year, we've seen a slight increase in our Medicaid payer mix, which is the top line, and we're currently at about 58.8%. Private pay is 37.3%. Medicare is 3.8%, and the bottom line is our VA, and we were at 0.2% in the month of September. So you do see a slight increase in the Medicaid payer mix, but again, with the payer mix that we have right now, is very acceptable level of Medicaid when we consider how much private pay that we have in the building. Financial position. Again, this is year-to-date through September, and we're showing a positive cash from operations year-to-date of $620,000. So we've got about $10.5 million in revenue, plus a non-operating income of $838,000, which is our accumulated property tax revenue, and operating expenses of $11.2 million. And then when you add back the depreciation, that's where you get your cash. So just keep in mind, so roughly we have about $1.1 million to $1.2 million in revenue in general, and expenses are roughly about $1 to $1.2 million in expenses in any given month. And here we have our cash, receivables, and accounts payable. So again, the top line is our current accounts receivable, which has dropped to $4.4 million. It was $5.2 million in the month of August. Accounts payable is $1.5 million, or about $1.6 million. And then our cash was up a little bit in September at $525,000. So again, keep in mind, as I just mentioned, let's say our revenue averages about $1 million a month. So our receivables are out basically 4 months on a dollar-per-dollar basis. And our payables at $1.6 million, we're basically roughly between 30 and 60 days out on our payables. So in all intents and purposes, we are caught up on our payables. Medicaid payments, knock on wood, so far the state continues to make regular monthly payments. We got paid in October, and we should be receiving our next payment, if the state will be on time, within the next couple of weeks. Maybe because of the holidays, I would not be surprised if our November payment did not get transferred until the first week of December. But again, through the month of October, we have been paid, again, because of the consent decrees, on a monthly basis. And basically, the state is paying us within approximately 30 days. So again, we showed that the receivables had dropped down to about $4.4 million. And a couple of reasons, and primarily it's Medicaid. I think I had spoken to you with last quarter's report that we were having problems getting paid by Health Alliance and Molina, our two managed care organizations that participate in the dual eligible managed care program. And so you can see in the summary that we have made improvements in getting both of these payers to pay us on a more regular basis and to actually get caught up on our past due receivables. So Health Alliance, back in May, had owed us $503,000. Currently, they owe us $122,000. We just received a payment of $104,000, and that number will probably go up by roughly $100,000 as soon as we bill November services at the end of the month.
Mr. Gimia, do you mind being interrupted with a question for Mr. Quisenberry?
Go right ahead.
No, this is very good news. Can you give us any reason why we suddenly made some progress there?
Just rolling up our sleeves and communicating with them on a regular basis, giving them updates on what has been paid and what has not been paid. I mean, basically, we were sending them a spreadsheet every week.
Well, sounds like a lot of work, but we appreciate it.
So, and again, with Molina, Health Alliance is probably more problematic, even though the numbers are about the same. Health Alliance revenues, right now, we collect on average about $100,000 a month from Health Alliance. Molina, roughly about $52,000 to $54,000 a month from them. So Molina right now is pretty much, they're paying us just over 30 days, even though the number's 120, I should say it's probably just under 60 days. And there's always timing issues in terms of when we actually get paid and then when we're billing the next month's bills. Health Alliance, we're still working on getting them cleaned up, but again, you can see that we have significantly improved our receivables from them. And on a side issue with Health Alliance, I think all of you have...
There's another question from Diane Michaels.
Just real quick. Current through the end of October or the end of September?
Actually, through the end of October.
Okay, thanks.
And on the side issue with Health Alliance, I believe all of you have heard that Health Alliance is no longer, or as of January 1st, will no longer be participating in the dual eligible managed care program. So they will continue to participate in what I call the Medicaid-only managed care program, which really doesn't affect us because we don't have any Medicaid only, because again, that clientele is typically a younger population, typically below the age of 65. Obviously, Medicare starts covering at 65. But Health Alliance will be pulling on January 1st. So what does that mean for the nursing home? It will mean that these residents actually have just received a letter, probably within the last couple of weeks, from Health Alliance saying that they have basically three options. One is to, they will be automatically enrolled. If they don't do anything, they will be automatically enrolled in traditional Medicare and Medicaid. They have the option of signing up with a Medicare Advantage program, so then they would be in the Medicare managed care program and traditional Medicaid. And the third option is they can sign up with Molina Healthcare. I believe that the provider panel for Molina is much more limited than Health Alliance's health provider panel, and I believe that the majority of our residents will probably end up going with traditional Medicare and Medicaid. So the end result for Champaign County Nursing Home is, number one, these residents can remain in the nursing home. They will still have coverage by either Medicare or Medicaid in some fashion, and we will still continue to be paid. Now, Health Alliance and Molina have both been paying us on a regular basis, because again, they are seeing the same payment issues from the state that we are facing. So if our current roughly 33 or 34 Health Alliance members go to traditional Medicaid, then they'll be in the same boat as the rest of our traditional Medicaid in terms of any future payment delays. And again, that is potentially significant because both Health Alliance and Molina have stated that if there is a payment delay, that at least in the short term, they would continue to pay providers. And short term, typically, they've been saying over the last few months would be 3 months. And after that, they would probably themselves have to stop paying the providers. But they could actually float to providers for a short period of time. But again, you know, with the health plans, you're talking about significant amount of dollars that they would continue to be paying out despite not being paid by the state. So, but again, we'll have to wait to see what happens with what the state payments. The other factor that has been improving our Medicaid receivables is we have been able to reduce the number of open Medicaid applications. So again, in January, we were at our highest point where we had 60 applications being processed by the state, and we currently are at roughly 25 applications. So that has, and those applications, Some of those members have been passively or automatically enrolled in either Molina or Health Alliance. I don't know the specific numbers or exact numbers, but the majority of them have been accepted into also traditional Medicaid. But by reducing our applications from 60 to 25, that does improve our ongoing cash flow moving forward. And again, the conversions that take place when these applications have been approved, again, I forget, but the number of days year-to-date is between 3,000 and 4,000 days that have been converted so far this year. All right, any questions on that before I switch gears and talk about staffing and quality indicators? All right, open positions. So again, for CNAs, our target, if we can fully staff our CNAs and eliminate agency, is roughly 84 or 85 CNAs. So what you see up on the screen is the current number of open positions, and we have made progress through the month of October, but we still have work to go. We have 33.5 FTE positions open. Now, what is not reflective is the current numbers, which I don't have, but what I can tell you is that we've had 2 orientation sessions over the past 3 weeks. And in those 2 orientation sessions, we've had 9 new CNAs, and we've had 3 food service workers in those orientation classes. We have another orientation class that is scheduled for the first week of December, in which right now we have 5 CNAs and I believe 1 food service worker in that orientation class. So again, to just give you another frame of reference, we reviewed in the month of October over 30 CNA applications. We had been averaging in the months before roughly 20 applications. So we have seen an increase in the number of applications for CNA positions in the facility. And again, just on a side note, we also have 2 nurses that will be in the orientation class in the first week of December. So at the bottom of the slide, you can see with dietary, we have actually met our staffing levels, which is basically 16.45 FTEs. I can tell you that we recently had to separate 3 food service employees, but even though in the month of September and October, we technically had reached full staffing, we did not stop advertising and processing new dietary employee applications. So when we had to separate those employees for performance issues, we already had replacements in the queue going through orientation, and they are currently working at the facility. So again, I also mentioned that in the December orientation class, we have a couple of dietary employees slated there. So again, we're going to continue to do that, assuming that there may still be some level of turnover, because we don't want to fall behind in open positions. So if we can maintain our full dietary staffing, obviously that's our goal.
Mr. Alex.
Scott, to what extent does census drive the nursing, CNA and nursing shift load? Are you able to scale back on staffing as with the census being lower?
Yes, we do. And typically, always the first to go would be agency.
So there is some cost reduction associated with the lower census.
Yes, and I'm going to jump ahead, and I probably should have put this slide earlier. So you can see our contract nursing monthly expenses, and again, the high percentage of the cost is with CNAs. And you can see that in October, our expenses are down to $67,000 for agency. All right, now backing up to our turnover and retention rates. And so again, what we have here, you're showing from June, July, August, September, is in each of those periods a 12-month look back on turnover rate, meaning how many employees separated, divided by the number of employees that we had at that time. So again, you can see our turnover rate, and this is for all employees. Our turnover rate has increased slightly between June and September. Our retention rate has actually improved slightly during the same period. But in both indicators, we are still falling behind our benchmarks, which is again from the American Healthcare Association. And if we take a look at CNA specifically, again, the same trend. Our turnover rate still remains very high compared to our benchmark and has increased slightly from 74.7% in June to 78.9% in September. And our retention rate also shows a downturn from 64% to 62%. And I don't have the stats on a slide, but what I can tell you is that in the month of September, we had a high number of separations with CNAs, and that number was, I believe, 8 CNAs, and I know in October the number is down. So hopefully, again, with the efforts that we have in place to reduce our turnover, and again, I've talked about this before, we have implemented a preceptor training workshop program where we have picked specific employees within nursing, CNAs, laundry, housekeeping, and in the kitchen who are being trained to precept new hires. And again, obviously, you also know that we are currently in negotiations with ASME on a number of issues. And the other thing I wanted to point out that I haven't mentioned before is that the facility in Karen has been implementing what is called the Team Steps program. And Team Steps stands for Team Strategies and Tools to Enhance Performance and Patient Safety. And this is a specific program that is put out by I want to say it's funded somewhat by the federal government. And it's called the Agency for Healthcare Research and Quality. And this program was developed by them and by the Department of Defense. But it's a healthcare performance improvement program specifically to build teamwork, collaboration, and communication, specifically to improve and optimize resident care. And the best way I can characterize this is this program is designed to educate our staff, and especially our frontline clinical staff, nurses and CNAs, to empower them so that when they identify an issue with a resident, that they will follow up with that issue even if they approach another employee who basically ignores their concerns, and to make sure that they empower themselves to make sure that issue is followed up upon. Because what we continue to see on a very frequent basis is there are issues that will fall between the cracks, whether it's just a comment about a resident that's reported at the end of the shift to the oncoming shift that, so-and-so wasn't feeling well, she didn't eat as much today, keep an eye on her, and making sure comments like that are actually followed up. So if a CNA notices a change like that with a resident, a CNA is not trained medically or clinically to understand what the ramifications of a change in behavior could mean, but a nurse does. And so we have always instructed our CNAs that they need to inform the nurse of their concerns. If that concern isn't followed up by that CNA should take the initiative to then either to go back to that nurse or to go to a supervisor or to a nurse manager or even the administrator if necessary to say, I had this concern, it wasn't followed up upon, I'm still concerned, and I'm worried about this resident. Can you do something about it? And this is the type of mentality that we are trying to get actually with all our staff. This program is designed specifically for clinical staff, but we want the same mentality and thinking and teamwork and collaboration with every employee. It doesn't matter if you're a housekeeper or a laundry employee or even a food service worker. If you notice an issue, resident care or otherwise, that needs attention. We want our staff to be empowered to make sure that something is done about that issue. And that's what this program is. And we've been working on this for the last few months, and we're continuing to educate. And again, you can call it an offshoot. The same concepts and philosophy is also being implemented in that preceptor training program. And again, we're empowering those preceptors to be proactive, because that's their opportunity to shape and mold those new employees in the building to do what we want to do, to build a better collaborative culture within the facility. And again, this takes work and it's going to take time. And again, this program that we're implementing was designed not only for nursing homes. It's also designed and is being implemented within hospitals and other healthcare provider settings. So again, there's been a lot of work and study by both the Department of Defense and the Agency for Healthcare Research and Quality. And so it's not something that we just thought up ourselves. It is a comprehensive program that we are currently working to disseminate throughout the facility. All right, last topic is some quality indicators. And again, here are our food service Pinnacle scores for dining service and food quality. And you can see in both measures that we have seen in the month of June, increases in both of the scores. But what I did here, one of the problems that we have with the Pinnacle scores is that the monthly score is based on 15 interviews with either residents and predominantly with family members. And so the measures, any of these 16 or so measures can be easily skewed by very good scores or very bad scores. So the feedback that I receive from our board of directors is, can we get a better sample? And the best way to do that is to summarize these scores on a quarterly basis, which basically gives you in each quarter roughly 45 or so interviews as opposed to 15 on a monthly basis. So I believe it gives you a better idea of the trends that are going on. So again, if you take a look at dining and food quality, you can see that in both of the measures, we're seeing improvements. But I know that we still have a lot of work to do, but at least we're seeing these measures improving on a quarterly basis. And the last two measures that I wanted to bring up, and I believe this is the last slide, is what I believe are the two best overall indications of the overall perception of the facility. So the first one is overall satisfaction, and the second one is recommend to others. And when you talk about what we're seeing in the environment, because hospitals and managed care organizations or managed care plans are actively profiling the nursing homes in their respective markets. And what comes up time and time again is they want to see the score of how is this facility recommended to others? Is it highly recommended to others? You know, if you're asking your neighbor, where would you want to send your family member to? Would you want them to send it to Champaign County Nursing Home? And you can see for recommend to others that our average has been running over 4, and we've been at 4.2 in the first quarter in this chart, 4.4, 4.24, and 4.29. And I just want to point out that the national average for that score is 4.33. So in the quarter from January to March of 2015, we actually exceeded the national average, and in the last 2 quarters, we've been just below. So I'm not saying that obviously everything is going well at the home, but with this measure, we're doing pretty well compared to the national average in terms of our residents and their family members' perception of whether they would recommend this facility to others. And same thing with the overall satisfaction. In the last quarter, it was 4.08. And the national average for overall satisfaction is 4.16.
I know I'm set in my ways, but I have this isn't a criticism, just a suggestion. But on these type of things, if the scales could stay the same on both sides, would really help me.
Very good point, yes.
And then I spent some years in banking like Diane. It just, again, just a suggestion. I'd rather see Q1, Q2, Q3 instead of the months kind of thing and make it easier for me to review. Again, just a suggestion. Thank you.
Mr. Maxwell.
Maybe you're going to get to it, but what is our current CMS star rating?
Our overall star rating is still 1.
Other questions for Mr. Gima? Well, I have one. The finances appear a bit better than at the last board meeting, the nursing home board meeting, so that is encouraging. But at the last nursing home board meeting, you talked about rather seriously your concern that money could potentially run out in April and we'd be in a tough spot with this bit of change in the money coming in. Do you have the same concerns, or has this alleviated some of those?
No, it doesn't alleviate it. If the state stops paying Medicaid for any period, and again, in our cash flow analysis, we can weather a 3-month payment delay without having the need to issue revenue anticipation notes. But if the state delays payments over 3 months, we would need revenue anticipation notes to tide us over until the state starts payments once again. So, and again, based on our cash flow analysis, we can maintain operations. We won't have to make any cuts in any services. It's basically business as usual, but we would need the revenue anticipation notes if the state does not pay us for more than 3 months.
Thank you. Oh, wow. Mr. McGuire, then Ms. Bergson.
Okay, on the state payments, I want to make sure I understand this because I asked some questions of a legislator and got a response. When you're talking about the state payments, right now we're receiving the federal Medicaid funding, right? Is that the payments that we receive? And then the state is not paying their matching amount and hasn't paid it for 2 years.
Okay, so there's 2 issues there. The first is the Medicaid, and I think the second issue that you're bringing up is the intergovernmental transfer money. So the Medicaid payments, so maybe this helps. So our non-IGT Medicaid payment is roughly about $140 a day. I'm rounding it off. The IGT gives us an extra roughly $15 to $20 a day more.
Stop you there, so
Okay.
I understand it. Is that the state matching part of the payment, or is that the
No.
federal Medicaid? Okay.
So if our base Medicaid payment is $140 a day, the feds contribute 50% of that amount, so $70. And the way I've been told it works is that the state pays us the $140, and they can then immediately go to the feds and say, I paid Champaign County $140, and then the federal government will then reimburse the state $70. So the state does not get the federal matching dollars until they make a payment to the provider. The IGT is a separate payment that the state makes to the county nursing homes across the state. And so that payment is made on a quarterly basis. And so it's roughly $15 to $20 a day. It is based, without going into all the details, on an estimated rate. And that rate has to be reconciled at some point by the state Medicaid department. They're behind in reconciling for the past 2 years. And so that's the reason why the IGT receivables has been going up. And so the receivable is based on our calculations, based on the information provided to us by the state. And we have talked to them about it. As recently as roughly about a month, month and a half ago.
But the part that comes through from the federal government that you're saying you're concerned you're not going to receive, that's something that the state hasn't stopped and won't be able to stop. It's the other part of the state, $140,000 that you're concerned you're not going to receive.
So my primary concern is that the state will stop making the $140 payments. When they stop making those payments, any of the IGT payments will also be stopped because they can't collect any of the IGT monies from the federal government as well until they make a Medicaid payment to the facility. So right now, there are 2 consent decrees that is forcing the state to pay all of the Medicaid providers in the state. The controller has publicly stated that there is not enough cash to continue to pay the Medicaid providers under the consent decrees without a budget in place. And again, because the budget is expected to have budgetary cuts in it. So right now, we are being paid the same Medicaid rates that we were paid as of April. That's the last time that we had an actual adjustment in our Medicaid rates, because our Medicaid rates change every quarter. And the last rate change was in April. So we are anticipating a rate cut, but right now we are being paid the rate effective April 1st. But I am anticipating that at some point, probably in early next year, the comptroller will have to start slowing down Medicaid payments. And again, with all the phone calls that I've been making, no one knows when it will start and how long the payment delay would be, whether it be 3 months or 6 months. Now, the convention, I shouldn't say conventional wisdom, but what I keep hearing, and they're basically just educated guesses from our contacts in Springfield, basically the associations that represent the nursing homes, either on the for-profit or not-for-profit side, and they believe that a 6-month payment delay is a good bet, but that's all it is. It could go longer, it could be shorter. So again, what we did is did a cash flow analysis to see could we weather a 3-month payment delay and or a 6-month payment delay, and we actually went even further. And what our analysis shows is that we could actually weather a 3-month payment delay without requiring the need for revenue anticipation notes. But anything more than that, i.e. a 6-month payment delay, we would need revenue anticipation notes to borrow against those Medicaid receivables so we continue to receive cash to pay our bills, and we could do that. So Jim, I don't know if I'm answering your question. So it's all based on speculation of what the states may do. But again, everyone tells me that it's very, very likely, if not guaranteed, that there will be a slowdown in Medicaid payments to providers across the state.
Okay, there's a lineup. First Ms. Bergson, then Ms. Michaels, and then Mr. Shore. Microphone.
Since everybody is starting to pay you better, why they still, what makes up that 4 million receivables balance?
Okay, these are rough numbers because these actually go back to August. So the biggest is private pay, roughly about $1.5 million. Next would be the IGT, roughly about 1.3 million. Medicaid is about $1 million. Those are the biggest ones. Next, after that, it would be our Medicare Advantage or HMOs, and that's roughly $900,000. So the biggest chunk is private pay.
Now, is that real private pay, or is that the private pay that will turn into Medicaid rates when
The majority of that is private pay that will turn into Medicaid. So that's roughly, out of that $1.5 million, roughly $1 million is private pay that will turn into Medicaid.
So how much will you lose when that happens? How much less will it be?
So the conversion is roughly $40 per patient day that we lose when we make the conversion.
So how much would that be? What percentage of that?
Hang on, I'm terrible at doing math in my head, so just bear with me real quick. So for one resident, for 1 month, that's roughly $1,240. Over 12 months, that's roughly $15,000 per resident.
And how many of the residents are there? How much of this?
So right now, we have 25 applications currently open.
And how much of this, how much of this virtual money does that mean? How much of the accounts receivable is virtual money on the basis of that?
Well, yeah, based on that question, it's that $1 million out of the 1.5 million in private pay. And so again, you know, if you just took a snapshot and said all of those 25 applications would convert today, then our private pay receivables would be reduced by $1 million, and then we would technically increase our Medicaid receivables by, again, I can't do the math in my head, so let's say by about 600 or 700, let's call it $600,000.
Okay.
So, but again, you know, it doesn't work that way on an ongoing basis because we're always adding new applications while others are being converted. But
there's virtual money in that
but
accounts
yes,
receivable.
without question.
And you think it's about 400,000 now?
Well, it's $40 per resident day. So again, you know, the average private pay revenue per day is roughly about $180 to $190 per day. And again, Medicaid is paying us roughly with the IGT about $150 per day. So that's a conversion from roughly $190 to $150 per day.
Thank you.
Ms. Michaels?
Well, I had a lot of questions that kind of went with what Mrs. Bergson said, so I appreciate the questions. But I'm going to go one step further here. We're receiving the Medicaid payments now, pretty much. The IGT is the money that we're not really getting, correct? And that's the 1.3 million that you say are approximately in the receivables?
The state is behind in reconciling
And how
the
long
IGT
is that?
payments.
Are we talking, these receivables, is that 6 months, a year, what?
Oh, they're behind 2 years.
Okay, so 2 years. And then we don't foresee, do you know approximately how much per month we're losing?
That, off the top of my head, no, I don't know that number.
Okay. And that's based on our census that we turn in quarterly?
Yes.
Okay.
Mr. Shore?
Last time you presented, I know there was a little bit of discussion about trying to lobby the comptroller's office for some sort of guarantee of at least a percentage of reimbursement. Has there been any progress on that?
We're still trying to get that meeting with the comptroller. I actually talked with our lobbyist a week and a half ago, and so he's still working on that. So.
Mr. Anderson?
Reference the RANs that you foresee the potential need for. I'm making the assumption that this board doesn't approve the nursing home making application for RANs. And your forecast that you're getting from people in the industry of the likelihood of payments not being made. You could hold off 3 months. What would happen during month 6 without the RANs?
Without the RANs, then our only option would be to significantly delay payments to our vendors. And again, if we actually didn't do that scenario, but let's say that we could push our bigger vendors, which would be dietary, rehab, and pharmacy. So again, back in 2011, we actually were out 12 months, especially with our rehab vendor, and that receivable was well over $1 million. So it is feasible if we pushed our vendor payments out a year to be able to weather a 6-month or more payment delay. But again, that would be our only option. And if the vendors would not cooperate with us, we'd run out of cash, plain and simple, and we'd have to close up. But the only option we would have would be to delay payment to vendors.
Mr. Maxwell.
That's not a very good option. As I recall, some of our vendors really nailed us with interest cost on the last time around. So we'd be far better off to borrow the money if we could, rather than borrow it from the vendors, because the vendors will charge you probably 12 to 18% interest.
That is correct.
Any other questions? Yes, Mr. Alex.
Sorry, Scott, real quick, can you clarify, I'm sorry, I may have misheard this. Can you clarify the situation with the IGT transfers? They are not being made at all, or they are being made at a 2-year-old rate?
The best way I can characterize is they are making what I would call interim payments. So, but they have to go back and reconcile those payments once they audit the Medicaid cost reports, and they're behind in auditing the Medicaid cost reports. And
Meaning, to what extent do we think the interim payments are off?
And again, we believe, and again, we've checked with the state Medicaid people, and they agree that our calculations for our IGT rates are correct. So, and we also did a comparison with DeKalb, and based on that, we believe that those receivables are calculated correctly.
Okay, so that, I'm sorry, it was 1.2 million in IGT receivable? How much?
Yes.
That 1.2 million, cash is coming in the form of IGT transfers, but that receivable on the books represents the accumulated difference between what we think they should have paid us and what they've actually paid us?
Yes.
Are the payments at the wrong rate being made in a timely fashion?
Yes, on a quarterly basis.
Okay,
yes.
thank you.
I see a lot of puzzled looks. Any more questions? All right. Thank you, Mr. Gimas, so much, and thank you for staying so late into the evening with us. Appreciate
You're welcome.
it.
Let me just make one
Oh,
more comment
I'm
about
sorry,
the
yes.
about the IGT. And again,
Yes.
it is very, very convoluted. And again, the only thing I can tell you, and this doesn't help clarify it, except maybe put into the context, that in 2011, when we had this big cash flow issue because we had a 6-month Medicaid payment delay, we also had an IGT issue at that time where the state hadn't paid us any of the IGT for 2 years. And then they finally got around to paying us. And I forget what the amount was for this facility, but I believe it was well over $1 million in past due monies. So, again, we have that frame of reference that we're working from.
Don't leave yet. Mr. McGuire has a question.
Well, just a comment. At least the comptroller's office is sending the Medicaid payments on time, and that's helpful. And you're catching up the other payments.
Yes.
That's good.
And again,
it's positive. We could not be we could be in the position that you're concerned about, which is not receiving Medicaid payments at all.
right. And again, you know, option B that we're working on, which can help us a little bit, or any of it can help, is talking with the comptroller to see, again, if there's some percentage of Medicaid payment that we can get on a regular monthly basis when everyone else is seeing a payment delay. Because anything that we can get would be helpful. But again, what we calculated that anything less than 70% of our typical monthly Medicaid payment, if that is made by the comptroller, anything less than 70%, we would still need revenue anticipation notes if there's a prolonged payment delay.
Again, thank you very much. Safe travels back.
Thank you, everyone. Have a happy Thanksgiving.
Okay, standing committees to speed things along here. All three, County Facilities, Environmental, Land Use, and Highway and Transportation, will accept and place those on file. And areas of responsibility, Mr. Quisenberry.
Thank you. I move adoption of Resolution 9441, appointing Frank DeNovo to the Zoning Board of Appeals for a term of December 1st, 2015 through November 30th, 2019. I so move.
Thank you, Mr. Schrader. Any questions or comments on this nomination? All right, seeing none, all in favor, say aye. Aye. Those opposed, nay. All right, thank you. Mr. DeNovo is approved. Continue, Mr. Quisenberry.
Next, I move adoption of, the Policy, Personnel and Appointments Committee moves adoption of Ordinance 969, the Health Ordinance of Champaign, adjustment to the Health Ordinance of Champaign County, Illinois, and I so move.
Second from Mr. Harkey. Any questions or comments? All right, seeing none, all in favor signify by saying aye. Aye. Those opposed, nay. All right, unanimous. Mr. Quisenberry, are you ready to proceed?
I am. Next, I will move adoption of Resolution 9448, honoring the employees, and I'd like to read that into the record after we get a second, and I so move.
Second, Mr. Esri, please continue.
All right, and I'm going to have some help from my friends here on this. First of all, this is resolution number 9448, a resolution honoring county employees. Whereas it is the vision of the Champaign County Board to be recognized leader in local government where every official and employee has a personal devotion to excellence in public service and embraces the highest standards of ethics and integrity, which enables Champaign County to provide the best customer services to its citizens. And whereas one element of pursuing this vision is communicating to employees that their service to Champaign County is valued and appreciated, and whereas Champaign County employees admirably serve the people of Champaign County with full commitment to the responsibilities of county offices, work in partnership with fellow employees and county officials, and have dedication to the best interests of all the people of Champaign County. And whereas the Champaign County Board wishes to recognize the dedication and service of employees who have reached specific milestones in 2015, I will ask Mr. Shore to start reading some of our employees.
With 5 years of service to Champaign County, Jeffrey Metzler of the Animal Warden Services, Stephen Thuney of the Coroner's Office, Marcus Page of the Corrections Department, Tracy Swisher of the Corrections Department, Barbara Blalock of the Juvenile Detention Center, Daryl Jackson of the Juvenile Detention Center, John Parsons of the Mental Health Board, Katie Jessup of the Public Defender's Office, James Oliver of the Physical Plant, Joshua Demko of the Sheriff's Office, Jonathan Rekis of the Sheriff's Office, and Robin Lever of the Treasurer's Office. Also, with 7 years of service, Tanya Wall of the Probation and Court Services Department.
Mr. Alex?
Thank you. With 10 years of service, Julie McClure, Gretchen Reed, and Amber Moore from Animal Control, Joni Hester of the Circuit Clerk's Office, David Wall from Corrections, Kelly Pfeiffer, Brent Fry, and Bonnie Meek from the County Clerk's Office, Faith Cagle and Gerald Stumborg from the Highway Department, Kendra Ward at the Juvenile Detention Center, Lori Hanson at the Law Library, and George Vargas from the Public Defender's Office.
And continuing on with 10 years of service, James Alsep from the Physical Plant, Charles Cheney from the Physical Plant, Penny Price, also from the Physical Plant, and Robert Reynolds from the Physical Plant, Edward Moody from the Sheriff's Office, Daniel Clifton and Brett Lemons from the State's Attorney's Office, Janae Weishart, also from the State's Attorney's Office, and Susan McGrath from the State's Attorney's Office and Support Enforcement. Mr. Esri.
With 15 years from the Circuit Court, we have Shamonia Campbell from Corrections. We have Todd Gill, Michael Johnson, Joshua Jones, and Julie Martin. From Highway, we have Damon Matowski, From Juvenile Detention Center, we have Stephen Coughlin, Jerry Hunt, Robert Oprenduck. Mental Health Board, we have Peter Tracy. Planning and Zoning, we have Susan Chavarria. And Probation and Court Services, we have Amber Davis.
Mr. Maxwell?
Okay, thank you. Continuing those with 15 years of service. From Probation and Court Services, we have Heidi Hukin. We have L'Oreal Kleppen. We have Siobhan Reynolds. Nicole L. Rolls. Elizabeth Schultheis. Amanda Wells. And from the Physical Plant, Norlin Copeman. From the Sheriff's Office, Stacy L. Corey. Again, from the Sheriff's Office would be Kevin Franzen. From the State's Attorney's Office, Sarah J. Carlson. Again, from the State's Attorney's Office, Lisette Lugo. And State's Attorney's Office would be Catherine McGee.
Mr. Rector?
With 16 years of service from Planning and Zoning, Connie Berry. With 20 years of service from Circuit Court, Orlena Pruitt. Staying with 20 years from the County Assessment Office, Joseph Mintz. From the Highway Department, John Emmon. From Probation and Court Services, Jeremy Jessup. From the Sheriff's Department, Doug Belashevsky, Thad Trimble, and Jeffrey Verkler. Going with 25 years of service from Administrative Services, Leanne Robeck. From Planning and Zoning, Johnny Hall.
No,
I'm sorry? Are you laughing at me or?
no, we all call him John, so I've never heard
Well, I'm the
Johnny
new guy.
before.
That's still the new guy.
Okay.
John Hall, John T. Hall. From Probation and Court Services, Michael Carey, and from the Public Defender's Office, Jenna Brown.
Also with 25 years of service from the Sheriff's Office, Brian Miniga and Carrie Shelber, Tracy Wagner. From the State's Attorney's Office with 25 years of service, Crystal Sullivan. With 30 years of service from Information Technology, Andy Rhodes. 30 years of service with Probation and Court Services, Teresa Zebby. 35 years with the Circuit Clerk, Cheryl Smith, and 35 years with the Sheriff, Sherry Miller, and our own County Administrator, Deb Busey, with 40 years of service. Now, therefore, be it resolved that the County Board of Champaign County hereby recognizes each of the aforementioned Champaign County employees as an asset to the citizens of Champaign County and expresses gratitude and sincere appreciation for their years of service presented, adopted, and approved and recorded this 10th day of November 2015. Thank you. Now we get to do that again.
Are you
kinda.
going to continue?
We need a vote on that resolution.
Sorry, yes, of course. All of those in favor of the reading of these names and entering them into the record indicate by saying aye. I am so tired. Okay. Yes, sorry about that. Approving the resolution honoring these employees of the county signify by saying aye.
Aye.
Those opposed, nay. That was good and hearty. All right, Mr. Quisenberry.
All right, next, I'm going to move adoption of Resolution 9449, honoring our retirees, and I would like to read that as well with a second.
Second? Second. Ms. Harrison. All right, would you read those into the record?
All right, whereas it is the vision of Champaign County Board to be recognized leader in local government and where every official and employee has a personal devotion to excellence in public service and embraces the highest standards of ethics and integrity, which enables Champaign County to provide the best customer services to its citizens. And whereas one element of pursuing this vision is communicating to employees that their service to Champaign County is valued and appreciated. And whereas Champaign County employees admirably serve the people of Champaign County with full commitment to the responsibilities of county offices, work in partnership with fellow employees and county officials, and have a dedication to the best interests of all the people of Champaign County. And whereas the Champaign County Board wishes to recognize the dedication and service of the employees who are retiring in this fiscal year 2015. We have Larry Adams, who has 31 years of service, Donna Alstein, who has 14 years of service, Pamela Burnside with 20 years of service, Thomas Herricks with 20 years of service, Stan Jenkins with 18 years of service, Dana Kunkel with 8 years of service, Gregory Mills with 18 years of service, Roberta Olson with 13 years of service, Laveda Pollock with 30 years of service, Gabriella Safranek with 18 years of service, Nora Stewart with 18 years of service, Deborah Wagner with 37 years of service, and Vicki Whirl with 20 years of service. Now therefore be it resolved that the County Board of Champaign County hereby recognizes each of the aforementioned retiring Champaign County employees as an asset to the citizens of Champaign County and expresses gratitude and sincere appreciation for their years of service presented, adopted, approved, and recorded the 10th day of November, 2015.
Thank you, Mr. Quisenberry. Yes, Mr. Shore?
Madam Chair, I wanted to amend this list to include Darlene Kleppel with 16 years of service.
Thank you, Mr. Quisenberry. Did you have a comment, Ms. Busey? Okay. All right, thank you for that correction. I appreciate it very much. And Mr. Weibel, yes.
Should be the 19th of November, not the 10th. Oh, you got that? Okay.
We had that problem with the first one, too.
Okay. Thank you for both
That
corrections
was the cow
here.
date, I believe.
Okay. All right, we set now? All those in favor of resolution 9449 indicate by saying aye.
Point of order, we need to vote on the amendment first.
Oh, that's right. Both amendments, both corrections, right? Shall we take them separately, or?
I would consider the date just be an editorial correction.
Okay, that's just an editorial correction. All right. All those in favor of adding Darlene Kloppel's name to the list of retirees indicate by saying aye. Aye. Those opposed, nay. All right, thank you. Now, let's vote on the amended resolution 9449 to include not only all those names, but also Ms. Kloppel. All those in favor say aye. Aye. Those opposed, nay. All right, we have that all straightened up. Thank you, Mr. Quisenberry. Mr. Alex.
Thank you, Madam Chair. I move adoption of resolution number 9457, authorizing the issuance of tax anticipation warrants in anticipation of the collection of taxes levied for the year 2015 by the County Board of the County of Champaign, Illinois for nursing home fund purposes as approved by the Finance Committee of the whole.
Second.
Thank you. Second by Mr. Quisenberry. Any comments or corrections on this? Seeing none, all in favor say roll call.
Schrader? Yes. Shore? Yes. Weibel? Yes. Alex? Yes. Anderson? Yes. Bergson? Yes. Cowart? Yes. Esri?
Yes.
Harper? No. Harrison? Yes. Hartke?
Yes.
Jay? Maxwell? Yes. McGuire? Yes. Michaels? Yes. Quisenberry?
Yes.
Rector? Yes. Petrie?
Yes. The resolution passes. Continue, Mr. Alex.
Thank you, Madam Chair. I move adoption of resolution number 9461, authorizing payment of claims for November 2015.
Mr. Quisenberry, thank you for the second. Any questions? All right, seeing none, all in favor say aye. Aye. Those opposed, nay. All right, this is unanimous. Go ahead, Mr. Alex.
Thank you, Madam Chair. Finally, I move adoption of resolution number 9462, authorizing purchases not following the purchasing policy for November 2015.
All right, is there a second? Mr. Quisenberry again. All right, any questions? Seeing none, all in favor, say aye. Aye. Those opposed, nay. All right, unanimous vote. Thank you. We have nothing for justice and social service. We have new business.
Madam Chairman, I would move that we suspend our rules to consider items 1 through 5 under Section 15 of new business.
Thank you, Mr. Esri, and thank you, Mr. Quisenberry, for the motion. Are there any questions on suspending the rules? All right, seeing none, all in favor say aye. Aye. Those opposed, nay. All right, we're set to handle that new business. All right, adoption of resolution number 9443, appointing Samuel Banks to the Nursing Home Board of Directors, term December 1, 2015 to November 30th, 2017.
I so move.
Thank you, Mr. Quisenberry. All right. We have a dual second over there, Ms. Michaels and Mr. Anderson. Any comments or questions? All right, seeing none, all in favor say aye. Aye. Those opposed, nay. All right, thank you very much. Adoption of resolution 9449.
9440, sorry.
What?
9440.
Oh.
That's a typo.
Okay, did you get that correction? The second one should be 9440. All right, adoption of resolution 9440, appointing Brad Pasalakwa to the Zoning Board of Appeals Committee. Term is December 1, 2015 to November 30th, 2020. Mr. Esri, what? All right, who's going to handle it then? Okay, all right. And Mr. Harkey? All right, thank you. Any comments or questions? All right, seeing none, all in favor say aye. Aye. Those opposed, nay. All right. Mr. Quisenberry, do you want to make the next one then, since these are under policy?
I will make a motion to adopt resolution 9460, appointing a supervisor of assessments for a term of November 20th, 2015 through November 19th, 2019. Madam Chairman, would you name the nominee?
Yes. Hi, Joe. Thanks for staying so long. The nominee is Joe Mintz. Is there a second for this nomination? Mr. Harbert, thank you very much. Any comments or questions? All right, seeing none, all in favor say aye. Aye. Those opposed, nay. Congratulations. We all look forward to working with you during your term of office and appreciate again your staying so long into the evening. All right, Mr. Quisenberry, do you want to handle the addenda?
Sure. I will move adoption of resolution 9463, appointing an applicant review committee for the Racial Justice Task Force that you have on your desk.
Second.
All right, Mr. Alex, thank you for the second. Any comments or questions? Seeing none, all those in favor say aye.
Aye.
Those opposed, nay. All right, a unanimous vote. And do you want to take the last one, since that is yours?
Last not least, the adoption of resolution number 9464, appointing a county administrator search committee.
All right. Are you going to read those in, or do you want me to read those in for you?
And the members of that committee would be myself as chair, Chris Alex as representing Finance Committee, Patsy Petrie as County Board Chair, John Schrader and Jack Anderson as representatives from the Republican Caucus, our Sheriff Dan Walsh, our State's Attorney Julia Reitz, our County Clerk Gordy Holton, Deb Busey, the existent County Administrator, and Barbara Ramsey, the Chief Deputy Auditor.
All right, there's already been a second. Are there any questions or comments for Mr. Quisenberry, since this is a subcommittee that he is setting up as policy chair? Mr. Alex?
When's the first meeting?
December 4th.
All right, any other questions? All right, seeing none, all in favor say aye. Those opposed, nay. All right, another unanimous vote. Thank you very much. Any other business? I have none.
I move adjournment.
All right, thank you. A second for adjournment? All right, thank you, Mr. Hart.